Okay, I hope it's all working. Hello? Hello? Okay. I have to do the promo bullshit, so give me a hot second. I'm still working on stuff in the background. I have to do all the posts again. I'm on time! I'm on time! Guess who woke up on time? Me! Me! I woke up on time! I woke up on time. I woke up on time. I'm genuinely so pleased with myself. Oh my god, I finally woke up on time. It's not me who's late. Nobody's late. I'm alive, and we're all good. Hello? Hello. Where we live. Just give me a hot second. Just give me a hi. Guess what? I woke up on time. Are y'all so proud of me? I also slept only like 4 hours. Right? I'm on time. Y'all should be so fucking proud of me. Like dead ass. Like, oh my god. Damn. I'm on time. Legitimately. I don't know, like, so yeah. What? I went to bed. I went to bed. I did go to sleep. You forget. I slept. Yes. Hello. I slept. Don't you worry. Ha ha. Ha ha. Look, I'm happy with myself because I woke up on time. No. No. My watch said I slept. My watch said that I slept. I slept a good amount. So don't worry. Ha ha. Ha ha. Ha ha. We're going to be talking about pathology. So this is going to take a while. Oh god, it's going to take a fucking while. As I still have to like open up all my notes because I am very bad at pathology. Basically, we're gonna go over like gastrointestinal stuff. We're gonna go through liver stuff. We're gonna go through gallbladder stuff. Basically, it's a whole lot of education and then hopefully some gaming later. Hopefully my audio wasn't like too loud. What? Yeah, sure. Yeah, absolutely. I'm still getting everything ready. I'm just very happy that I woke up on time. I'm so happy. I am legitimately so fucking pleased with myself. Like, legitimately, I am so happy. But yeah, okay. Okay, cool, 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 cool. Okay, so we are, well, so I have a lot of things to work on for pathology because pathology is a bitch and a half of a subject. And I hate it. I hate pathology. A lot of people know this already. Pathology is my #1 up. I will never like pathology. No, never will happen. Never ever. So we're gonna go through that today. Also, wait, am I supposed to post? Oh, right. Before I do any, wait, am I supposed to like quote repost this to VTubers? Is that where I'm supposed to do it? Wait, how come it won't? Wait, it won't let me. Where's the channel? What's the thingy? Wait, but you know the thing where you have to like, this is what like Mr. Main Manager told me. He was like, trust me, post your thingy on Twitter, repost it underneath like in the community of like VTubers exclamation point. And I'm like, how do you do that? I still don't know how that works. Like, I explain. America, explain. Like, I don't know how to do it. Legitimately, I don't know how to do it. If someone could explain to me, that would be amazing. Yeah, yeah. I don't know how to do it. I did it once, and then I don't know how to do it again. I don't know what I did. I don't know how I did it. Yeah, yeah, yeah. I'm still learning. I'm still learning. But yes, hello. Guess what? I'm on time. That's what I'm happy about. I'm actually alive on time. And I'll be here forever. But yeah, I'm just very pleased about that fact. But yeah. But yeah. But yeah. Oh my god. Hi Martin, how you doing? But yeah, hello. I'm on time. But yes, we're gonna go over GIT infections. I'm doing pretty well. I'm just excited to like get back into it once again. Because I am back here. But yeah. Oh my god, I am coughing. I am coughing. I need to drink more water. I need to drink some more water. Water. Okay. But yeah, so yes. Oh, oh god. Bye, that's so sad. Also, oh, Boathead. That is the doing of either Ryan. Yeah, it was either I think it was last night. I think it was last night. That's most likely last night. But okay, so we're gonna go through like I'm gonna yap at y'all about some stuff here. Like we're gonna go for like just a quick reference stuff. So we're gonna go over like some gastro. We're gonna do GI stuff mainly, so like the stomach and all that stuff. Oh, oh no! Oh god! Oh god! Bye. Like sparkling pink colored. So like, uh, wait. That could have been like blood. It could have been like blood. It could have been blood. I mean, so blood, frothy, pink. It could be blood. It could be some stuff mixed with blood. Who knows? I don't know. But okay. I can't because I don't know the full story. All you told me is that she vomited and then she puked. But I don't know. Like you said, it was pink. Pink colored. Maybe. It, I don't know. Maybe it was something that she drank. Maybe it was something that she ate. It could all be alcohol. I don't know. I don't know. I'm just spitballing saying maybe it could be hematemesis, but also like gross hematemesis is gonna be like super big. So, that ass, I wouldn't know. But okay, so now we're gonna get started on this. Also, wait, let me just make sure that the background music. Maybe. Maybe, who knows? But yeah, so we are gonna get started. Because basically, with some of the key concepts, I'm just gonna go through some fucking terms here. Because we're just gonna be talking. Because my wrist kind of hurts because I drew a lot today. So, comprehensive pathology of gastroenteritis, bacterial, viral, and parasitic infection. So, gastroenteritis in general, gastro, stomach, itis, inflammation. So basically, stomach inflammation caused by different things. So there can be viral, so caused by a virus. There could be bacterial, caused by a bacteria. Or there could be parasitic, caused by parasites. Y'all already know a lot of the parasites, obviously. Wait, oh my god, Lev is live. Oh my god, damn it. I would have watched your stream. I forgot it was today. Fuck. Oh well, but that's fine. But okay, so we have bacterial gastroenteritis, which is inflammation of the stomach and intestines caused by bacterial infection, leading to symptoms like diarrhea and vomiting. Viral gastroenteritis, viral infection, viral cause, same thing, diarrhea and vomiting. Parasitic, parasites. Huh? Wait. Oh, nice! Hell yeah! Hell yeah! Gastroenteritis, which is just parasitic gastroenteritis, which is just a GI inflammation caused by parasites, leading to various symptoms such as diarrhea, abdominal pain, less vomiting in this case, because it's gonna be like mainly GI, like lower GI stuff going on. But okay, so we're gonna go through some conditions that can cause our GI stuff. So cholera is a big one. Cholera is the disease, but this is mainly caused by Vibrio cholera, characterized by severe watery diarrhea and dehydration. Vibrios are gonna cause like rice water stools mainly. But yeah. Shigellosis. This is gonna be caused by Shigella, leading to bloody diarrhea and abdominal cramps. Because Shigella has Shiga toxin. Shiga toxin is the one that causes like hemolytic uremic syndrome in children, like in children less than 5. That's one thing, but we're gonna keep going. So we also have Campylobacter enterocolitis, which is going to be caused by Campylobacter jejuni, often associated with undercooked poultry. No, which then means, what does that mean for you guys? You're not allowed to have rare chicken. I'm sorry. I'm not allowing you guys to have that. That is absolutely verboten. No, not allowed. Absolutely not. We also have rotavirus. This is viral. This is going to be the one causing the severe diarrhea and dehydration in children, and this is going to be common in daycare settings. And Giardia. Giardiasis is going to be the one that causes steatorrhea and foul-smelling stools. And this is, again, going to affect a lot of campers. So the cool thing about the GI pathology, the GI pathology lessons and microbio is that they mesh really, really well together, which is very helpful for me because my brain is small and I cannot remember everything. I have to make associations to be able to remember everything. That is how my brain works. Actually, yeah. So I already went through a lot of, and there are more pathogens that we have to go through. There's so many pathogens we have to go through. So we have E. coli. So I'm going to go through the bacterial ones first. We have E. coli, we have Salmonella, we have C. diff, and there are various strains and these are different things. E. coli, there's multiple strains of E. coli, and these cause different diseases, including enterotoxic E. coli and enterohemorrhagic E. coli, leading to diarrhea. And there's going to be different different characteristics of their diarrheas. We're going to go into that later. We have salmonella, which causes gastroenteritis and typhoid fever. Salmonella typhi. You treat salmonella typhi, but you don't treat salmonella enterohepatica or enterocolitica. It's like a different salmonella. There are two salmonellas. There's so many things. It'll make sense soon, I promise. I promise. I promise. It'll all make sense. Okay, wait. Where was I going? I forgot. I lost my train of thought. Okay, and then C. diff. Y'all already know C. diff if you are scared of like too much antibiotics, because C. diff causes antibiotic associated diarrhea and pseudomembranous colitis because there's two toxins involved, toxin A and toxin B. Toxin A is going to be the one causing the diarrhea. That's the secretory. Pseudomembranous colitis is going to be happening because of toxin B. Because that's the cytotoxic destruction of the mucosa. But okay, we're gonna keep going. A lot of symptoms here. We're gonna go through like the main ones. So when you think gastroenteritis, you guys, like acute gastroenteritis because of, say, I don't know, food poisoning, what usually happens to you guys? This is an open forum. Tell me what happens to you guys. What do you think happens to you guys? Or if you've experienced it, what have you experienced? Like I'll Thank you so much for the hydrate, but I'm asking y'all the question. When you have experienced gastroenteritis in the past or have felt food poisoning in the past, tell me some symptoms that you've experienced. Have you experienced any of the following? Have you guys experienced like really bad diarrhea? Dehydration? Vomiting? Vomiting. Any abdominal pain or cramping? Have y'all experienced that? Like if you eat anything like weird, have you felt any of those symptoms? If so, we're gonna go through those. And there could also be fever, depending on how bad the extent is. Really? Lucky you. I have. I have multiple times. There have been multiple times where I have experienced all of these things. Oh, that's okay. That's okay, bye. Yeah. So, the first time that actually, one of the most recent times I've experienced this was like when I first came to the Philippines in June 2024. What happened was, I drank something that was kind of off. I like went to a Shake Shack, and honestly, the Shake Shack is really good. Like I don't know what the hell happened this time. It's a really popular Shake Shack, and it's in a mall. So like usually in a mall, you're not gonna have issues like E. coli or food poisoning or etc. 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 But I did, and during that time, I would experience just watery stools. Like say on the Bristol scale, either a 7 or a 6 or a 7. Wait. Oh god. I can't believe I said it. Shit. But yeah, like a 6 or a 7 on the Bristol scale. Have you seen the Bristol scale, you guys? I'm pretty sure I'm allowed to show this on the screen. It'll make sense when I show you the Bristol scale. It'll make sense, I promise. I'm loading a new web item. I am loading the link. I am editing this. Here we go. Here we go. This is the Bristol stool scale. When I mean a 6 or a 7, I literally mean a 6 or a 7. I had severe, like, it started out as mild, so like yeah, the poop chart. Hi, Maddie. Do you want to talk about poop? But yeah, so like I had mushy diarrhea. I had like, it was like, first it was a 6, like on the first day. It was acute. I had acute diarrhea. And then it got to a 7. That's why I was saying a 6 or a 7, because it started out at 6, ended at 7. Now you're never gonna associate 6, 7 with anything else but this. My job is done. I have stopped. I will hopefully be able to stop people from enjoying 6, 7. Yes, I am studying. I am studying. We're talking. Because we're gonna go through like what the hell is diarrhea. Diarrhea is basically, so diarrhea is classified as loose watery stools, and that's gonna be on the level of 6 to 7. 5 is like you're edging there, but that's gonna just be like soft blebs with clear cut edges. Type 3 to 5 is like 3 to 4 is normal. 3, 4, 5, those are fine. It's 6 or 7 that is scary, and then 1 or 2. Basically, if you're at both ends of the scale, you don't want to be there. You want to be right in the middle. How do you be right in the middle? Eat fiber, drink a lot of oil, drink a lot of water, hydrate yourself. Mainly fiber. Lots of fiber. Lots of fiber. Fiber is important. I'm gonna put the poop scale away. I'm putting the poop scale away. Oh my god. Maddie is here. Wait. I'm so excited. Hi. I am making sure that you can be heard. Give me like a hot second. Give me like a hot second, girl. How dare you? Hi. How are you, Matter?
I'm fine. I don't have that long but I have a bit.
Yay!
Which
It's Maddie again. We love Maddie.
And then I don't work tomorrow, so that's gonna be fun.
Wait, so you don't work tomorrow? Oh my god.
I don't work tomorrow.
I might do another one then. It'll be fun.
Okay. Let me know then.
I will absolutely let you know. I'll do a lot of gorilla streams, like probably this week, because I have to get a lot of work done.
I do too. My chem class started today. That class with the chart.
Oh, the bullshit? Ew. Gross.
I've decided that how I'm rounding the math that doesn't, have steps is that I'm going like, so, because he wants just to show work, but it's like, how do you show work for like 2 minus 1,
Oh yeah.
So all of these questions, like when he's like, so show math, so for multiply 2.5 times 3.33, he wants the answer in sig figs, because it's chem.
Yeah, it is chem.
So
you just put, like, if he wants 2 sig figs and it only ends up with like a round number, just put 0.00 at the end, you'll be fine.
Right, no, I know. But all of his, I don't think any of these will, is what I'm saying. Like, so what I've been doing is like, so the answer to that one, I wrote on a different line 8.325. Answer 8.3.
Well, yeah.
Like, because that's the only way that I can possibly think of.
8.5. No, you can do 8.33. You can do 8.33 because like 8.325.
I thought it was to the least number of figgies. I don't understand this sig fig shit.
Oh, you know what? Fuck it. Segue. I'm gonna explain sig figs to you.
Okay,
so sig fig rules. So okay, you already kind of know what significant figs are, kind of, but so any digit that's not 0 is always significant. You already know that. 0 is significant when it's between other digits like 205 or 3.604. if there's a decimal point and then any trailing zeros are significant figures, like 90.7500, da 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 da. But so how do we round in sig figs? So the significant figures. So solve. Oh, you're right. You can. Huh. Never mind. Oh no, I do. Okay, if you were. Oh, did you have 2 sig figs or 3 sig figs? Right. Oh, you're muted. Shit.
Oh, sorry. No, I don't understand. Sorry, I got a phone call.
Oh,
and
you're
then
fine.
it was like I pressed exit on the phone call, and then it was like, because it's just Walgreens. I don't need to talk to them.
Also, you can like double
And
check.
then
I double check always with the sig figs calculator because it also tells me
yeah,
the rules.
and this one said it was 8.3.
Oh, are you doing the 2 sig figs or the 3? Because sometimes they want 3, like 3.
It just says
like,
round
3
to the
total
appropriate
figures.
number of sig figs.
What are the other numbers on, like, did they show any numbers on the page at all? Just follow what their sig figs are.
So the only other numbers on the page as they relate to this specific question are 2.5 and 3.33.
Yeah, just go to 2 sig figs then. So it's just 8.3.
Okay.
But, yeah, but if you were doing it like so through the sig figs calculator, you can like round to significant figures of like 1, 2, 3. We were always use 3, so like 3 total sig figs, where it's like the number at the left end of the decimal and then 2 on the right end of the decimal. So like in your
so
case,
the thousandth place.
Yeah, the thousand. Thank you, the thousandth place. I always forget that part. I just know like how many there are. I don't know, dude.
I don't know anything past hundredths, thousandths.
Yeah, same.
Like,
same.
They were trying to get me last semester in fucking stats to be like the blah 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 place, and I was like, fuck that. Absolutely
Fair.
fuck that.
Absolutely valid. Absolutely fair. My god. But yeah. So like basically I just use this, but like the significant figure rules, like honestly, like what you can do is just like practice counting significant figures. Because that's what I had to do. Like I had to print out basic. My parents had to like print out
because
basic
dosing calc is probably going.
Bullshit.
Is dosing calc? Dosing calc would be sig fig, wouldn't it?
Yes. Yeah. Let me.
Okay.
You know what? Segue on the pathology. Show me your worksheet.
You don't want to see this worksheet.
Let me see the worksheet. Maybe I can help.
Okay. Hold on. I also am just. I'm trying to. There. Okay. Where is the part here? Here.
Oh wait, I forgot to put on my throw-ums. 1 sec. I'll put on the.
I also part of this. I really hate that they didn't need. I really have a problem with like 96% of the worksheets that this place makes.
I agree. I don't like them.
So. Oh wait, hold on. Discord on my stupid this one. Done. Okay, no, thank you. Send this to Spectral. So these are the questions that I haven't answered yet. I also really hate the amount of fucking trees we're killing because they restated solve the problem, show your work, and express your answer with the appropriate amount of significant figures every single fucking time.
Oh, wow. So,
completely fucking unnecessary.
Calculate the density of that. Okay, so like you see on number 6 how it has 3 numbers, like 27.6. Those are 3 sig figs.
Right.
You follow the least. So like
is it always the least? Because I like
kind of.
Yeah, because
I just usually
like,
follow whatever they show, like whatever it shows on the paper.
Okay, I mean that's fair too. Like that's my kind of
like,
rule.
When I go
like
by vibes, I do that way.
Right, but like for me, like when I usually do that, like I hate to say it's for less important stuff, but it's for shit that's like it's like when someone at work sends me an email, if they send me an email and they include, like, you know, they say 7 space capital P capital M, like, I would copy that in my response, like however they format time or format date or whatever.
Fair enough. That's what I do because I don't want to mess with the system.
Well, right. But like, I feel like all of this is like actually like dosing calc is important.
Yeah.
The math is important.
Right. Fair. I totally understand that. But like for this, so dosing calc. Oh, a 6. Wait, what is a grain? I've never heard of this before. 1 minute.
Which one are you looking at?
The grain of aspirin to milligrams.
Convert a 6 grain of aspirin to milligrams?
Yeah.
Oh, so you went on to, that's number 10. Okay.
Yeah, I'm looking at number 10 and I'm like, so. Oh, I see. So 1 grain is equal to 64.7. Looks like they do a lot of like 8. So 64.8. Honestly, I wouldn't do that. Like 64.78798 milligrams. So 6 grain is going to be 388.79. I don't like it, but yeah, I don't fucking use grain. I don't know what person uses grain. Now
you're gonna curse me, and I'm gonna have like the one fucking doctor.
I'm sorry. I hope you never get the doctor that uses
who's
grain.
gonna write his fucking orders like this, and I'm gonna.
No. Do you know why they won't? Because we're all using EMR. They don't allow for grain. At least mine never did. Epic never did.
Bold of you to assume that he won't just circumvent the system by giving me a paper order.
Fair enough, but also I'm gonna at Psychen and be like, Psychen, have you ever written something in grain? I'm asking him right now. I don't believe.
Well, no, you know what? JF's gonna come back and be like, well, actually, I've had to, because there was this one specific time that a patient that I got from Cambodia or some shit, like, had some very strange condition that required a very specific dosing, and then we're all gonna feel like ass wipes.
Okay, fair enough. But also, JF seems to always be the exception to the rule. Am I wrong?
No.
Exactly.
No.
Exactly.
Like, so
like, we definitely need to take his opinion into account, but also you're not as fucking
I'm not saying dismiss him. I'm literally arguing that he's going to come in and share a very valid, very real experience that's going to make us look stupid. Not him, us.
Oh yeah, and here's the thing. Girl, I always look stupid in front of the doctors. It's fine. That's like my job.
Yeah, no, dude.
That's what I'm good at.
This was something, like, I literally spent a decent chunk of my time in therapy yesterday trying to unpack this phone call that I had yesterday.
Oh, God.
At work. Oh, shit. Where, maybe you know the answer. Maybe you know the answer to this, because no one answered me in Psychen server. Do hospitals... So, like, when someone is in, like, this in-between, like... So, listen.
Hey, guess what?
This guy was having...
He has never written a prescription in grain. Never.
Okay. That's good.
I'm waiting for Uni to respond.
Yes.
Okay.
So, when this patient's having an issue with his Cobra because he needs to be transitioned... He needs to be transferred from the hospital he's currently in to a nursing facility. But they won't do that until we verify the Cobra, and the timing of that is like being rude, honestly. So I was trying to see what I could do to expedite everything, because his mom is absolutely terrified that, like, okay, this is what I'm saying. I don't know much about his medical thing because, one, I don't want to know, not my business. The mom tried to tell me, she overshared a lot with me, but she basically was like, we don't know what happened, and the doctors don't know.
Oh,
Which
God.
obviously I would never say this to someone on the phone. No. If the police are responding to a wellness check, and he's getting better, and he's getting better enough that he transitioned from ICU to the med-surg floor, and now he's going nursing, they know what happened because he's getting better, or they at least have a very good idea. You don't want to say it, probably because there's a decent chance that he may or may not have offed himself or tried to.
Oh, God.
You know what I mean?
Yeah.
Like, so I don't know much about, I don't want to know, but I'm just saying, like, it was a sensitive situation. I was trying to see what I could do. She's absolutely terrified that while he's obviously making strides towards recovery, that he cannot care for himself.
Right.
You know, obviously, because then he wouldn't be going to nursing if he could be independent.
Obviously.
So she's terrified, like, because nursing won't take him until we confirm the Cobra. And so she's terrified that the hospital is just going to say, well, he's done here, and put him on the street.
Oh.
And what I essentially had asked in that server was, like, I explained what I just explained to you and was like, is that a thing?
I mean,
where you just, like, essentially leave someone on the corner to...
I have never heard of that.
Yeah, I was kind of like, what happens?
I would have taken them. If we couldn't take them in at the nursing facility, I would at least take them to the fucking apartment, because at least maybe they like, if it's an emergency situation, at least they follow under EMTALA. I don't know. This is a psych or JF question, actually.
Well, that's why I might have to, like, shorten it and actually ask. I did. I put it in the server and then no one saw it, but I think I might have to reach out to them individually because it's eating me up, and I honestly can't. Like, I had a hard time sleeping last night.
Yeah, ask.
Because well, and I think I know the answer because I've seen nurses in the nursing subreddit, but I need someone who's, like, worked in a hospital to say it to me so that I can sleep. Because, like, I think the answer is no, we don't just put people on the street, because I've seen nurses, and I want to say that I'm using the word complain very, very loosely because there's not another word for this. But, like, in the nursing subreddit, I've seen people, like for posts of, like, hey, what's your longest admit? You know, like, let's compare records. And it's like, and you know, tell me length and reason. And I'll see people, and usually for those really, really long admits, it's a social admit because there's nowhere safe to, like, discharge them. But they're too disabled to, like, go, like, so they can't go back home. Like, it's not an issue of homelessness, you know, because you can release a homeless person, from my understanding, like, if they are able to, like, kind of get up and take care of themselves, you know, they can leave. But if the person, like, the example that I kind of thought was pretty clear cut was, like, this person really belonged in a nursing facility, but I guess that, I don't know if this is, like, a federal thing or just, like, a hospital policy thing or this nursing home, but essentially, in order to be transferred to nursing, the patient cannot have had a fall within the last 24 hours. But this patient really, really loved to ambulate on his own when he can't. So he was not falling in the sense of, like, staff was not treating him well or whatever, but he's falling all the time because he's getting up when he shouldn't be. So he was basically, like, they had never been able to achieve a 24-hour span of him not falling. And so he was there for, like, I think 2 or 3 years. Because so he's essentially stuck on the med-surg floor.
No.
Because, like, they can't move him to the nursing, but they can't discharge him. Because he's not well enough to be discharged. You know what I mean?
Yes.
Like, on his own recognizance. So I'm pretty sure, because obviously if there were enough people who had these types of admits who, you know, where they're competing for length, that leads me to believe that no, we don't discharge people and just essentially leave them to die of exposure or starvation. But I would like, I'm gonna ask eventually. I just
Yeah, I mean, I completely understand. This is something where I would just like, honestly, I would be a bother and I'd be like, hey, wait, why are there two Maddies? I fixed it.
What do you mean?
There were two Maddies on my screen because I switched it over to my review with friends. So it would have my Quizlet. So basically,
you asked both of them.
I would ask both of them. You know what? Fuck it. Let's put.
You said Saiken responded. Did you DM him?
No. Saiken did not respond. JF responded.
Oh, I thought you said Saiken responded. My bad.
We're gonna have 3 Maddies on screen now. Fuck it.
Great.
Gonna put another Maddie on screen. There we go. This is chaos.
I'm being asked to convert grain.
Okay, but no, we have been wondering what is with the butter.
What?
What's with the butter?
What butter?
The butter. Why do you have butter?
Am I using the butter?
Yes. It's not
so
a
this
bad
is
problem. It's not a problem. It's just like why butter?
So it's a really old like community joke that I honestly think is so old at this point that if I didn't love this PNG tuber, I would really honestly need to retire it because I don't think anyone else, like anyone is left in my community who would remember this. A long time ago, I used to I used to play Plate Up and post the clips to TikTok.
Oh my god. That's so
And
cool.
One of the oh wait, no, this wasn't even Plate Up. This was oh my god, this was so long ago that I was doing kind of like React commentary content to Hell's Kitchen.
That's
or
you
know those really nice like Asian compilations of like Asian bakeries?
Yes.
I was watching those and like commenting on like all that shit. And one of them was just obviously it's baked goods. They're using a superfluous amount of fucking butter.
Yes.
And so there was a clip of mine that at the time was really, really popular, which was basically just of me going, oh my god, butter! Which is why I got that made.
Ah, I see. I love it. It's very
and
fun.
Now it thing. But now it just so kind of is the default, like it's my default neutral like PNG.
I see.
For like any season.
Fair enough.
But yes,
I don't
that's
think
the
you
story.
guys have seen my Fujitech because my Fujitech is just me sitting in the fetal position. I'll show it. Fuck it. How do I show the source? There we go. I'm gonna show this off because fuck it. We might as well. Technically, my exam isn't until next week, so I can just do basically whatever until then, which is why I'm still trying to be good and study. What the fuck? Gonna have to make a new browser source, I suppose.
Okay. So at least I feel better that JF has never done this, so I don't really need to understand the grain to milligram conversion.
I've just never seen it. I've genuinely just never seen it. And there I am. Here's me sitting in the fetal position.
Well, okay, so hold on. I'm just even interested in knowing, I mean, I don't have any aspirin here.
Right.
So they're saying that a 6-grain tablet of aspirin is, roughly speaking, depending on how you're rounding this, about 390 milligrams. How much is one pill actually of aspirin? Like, is this even, like, a dose that you would even give someone, or do they just pull numbers out of their ass?
Honestly, do you have an aspirin on you?
No, I don't. That's why I was... For reference, a standard 5-grain aspirin tablet is labeled as 325. Okay. So this is a really stupid. Okay.
Okay, so all I can see, like, whenever I look up the aspirin, like, formulations and shit, it's 81 milligrams. Yeah. 81 milligrams.
Okay.
A low
So
dose
then-
aspirin is... Let me see.
So that doesn't make any sense because if it's 81 milligrams
Yeah, girl, I
Per-
don't fucking know. Where did the grain...
per grain, or just one tablet is 81.
So one tablet is 81 milligrams.
Okay. This is so dumb.
Yeah,
So
I've never...
okay, so
heard
one
of grain.
tablet, one grain is 65 milligrams.
Yes.
Okay.
That's what I'm very confused by, because I don't understand. I legit don't fucking get it.
So then 6 grains times 65
Uh-huh.
equals your mom,
True.
which is 30. No. We're gonna do, okay, 6 times 65 equals 390.
Hello. Hi. I'm glad it hit me this time. I don't know why. It's been missing me a lot for some reason.
But I guess, like, is it, so it is the answer is 390. I'm just,
Yes.
Jesus.
Yeah, the answer is 390. That is true. It is funnier when it, like, just completely misses me, though. I agree.
This is like the stupidest fucking,
I agree.
it's not even real.
I don't understand, like, what is significance? Oh, okay, so Yune is agreeing. Grains are stupid. She said she had to learn it for the for the Naplex, Naplex, but it never showed up. And according to Rico, it is because older MDs want us to suffer. Is it 60 milligrams or 65 milligrams? It depends on the moon's orbit. So it doesn't matter.
The
What I'm
dosage
hearing-
of a standard 325 milligram tablet is sometimes given as 5 grains.
My question is, who care? Give MG. We like MG.
This is-
Are we in the olden times where that matter? It does not matter. It no matter. Fucking hell.
Jesus. I don't want to do this.
It's stupid. It's absolutely stupid. I don't know how to I don't know how to help you there. But do you want to know what the hallmark symptom of cholera is?
Sure.
It is severe secretory diarrhea caused by toxins.
Fun.
Did you know that the bacterium responsible for cholera is Vibrio cholera? Now you know. I think the incubation period for cholera is like up to 8 days. Yeah, it's like, you did like 3. Yeah, up to 8 days. Let's take a guess, you guys. What kind of diarrhea is associated with cholera?
Well, don't you die, like, it isn't, I mean, isn't the cholera the one where you just shit your brains out?
Yeah. Why?
And you kind of basically, you're dying of dehydration.
Yeah. Why?
Because you're shitting on the Bristol school chart where basically the part that it's liquid, the 6 or whatever, the 6?
7.
7.
7, yeah. But like the reason why is because it's the secretory toxin diarrhea. Because like there's
So is it
actually
technically the cholera that kills you, or is it the dehydration as a
it's
consequence of the cholera?
huh. So like yes, kind of yes. Because like for Vibrio cholera, the problem mark is just severe secretory diarrhea caused by toxins released by the bacteria. Because technically the Vibrio organisms are non-invasive. And they remain within the lumen. So you're not gonna have bloody stools. You're just gonna have shit your brains out stools. But it's not gonna be bleeding.
Okay.
So like the complication is really the dehydration, the hypotension, the muscular cramping, the anuria, the shock, the loss of consciousness, and death is because of the abrupt onset of voluminous diarrhea. That's greater than like 1 liter per hour. That's why they call it a rice water stool. Mainly because
Right, because isn't what medications would you even give someone with?
Oh, I can tell you that actually.
Mm-hmm.
I'm pretty okay. So cholera. I mean, you wouldn't be giving like Imodium or anything, but for Vibrio cholera, the treatment, it's gonna be like mainly like rehydration therapy.
Right. Mm-hmm.
Rehydration therapy, but the medication, you can the antibiotics. I think it's like, oh god, JF's gonna get mad at me. They're all gonna get mad at me if I get this wrong.
It's fine. He's not here. He doesn't watch. It's fine.
I know. I'm glad he doesn't watch stream. Thank fucking god. If he did, I would be having trouble. Antimicrobials are gonna be like azithromycin, tetracyclines. So like doxycycline. I was like trying to remember if it was like doxycycline or like, yeah, it was doxycycline. You can give that, but also you can give doxycycline, but azithromycin has like more, like there's increasing resistance to azithromycin going on. Because treatment, and like this is a problem because treatment options are limited and patient outcomes can be worse if everything's resistant to the bacteria that we got on hand. And for infants diagnosed with cholera, they should be treated with oral rehydration supplementation while breastfeeding and zinc supplementation. And also vitamin A supplementation has been shown to reduce morbidity and mortality in children from 6 months to 5 years old. And antiemetics and anti-motility meds, so like Imodium or like metoclopramide. Metoclopramide is an antiemetic. Imodium is an anti-motility med. They have been found to have no benefit and may impede ORS therapy. So you wouldn't give those, but you can give like rehydration. Just you need to give them as much rehydration as possible. Because like you can shit out like a liter an hour.
Fuck.
Yeah. The complications of diarrhea of cholera I kind of already mentioned, but like dehydration, hypotension, muscle cramps, confusion, death, basically everything from dehydration. Yeah.
Mm-hmm.
And shock and death. And now we're going to go on to Campylobacter enterocolitis. So enterocolitis from Campylobacter, it's from C. jejuni. This is going to be the most... Did you know that this is the most common bacterial enteric pathogen in high-resource countries? So, like, in the States.
Mm.
It's also a significant cause of travelers' diarrhea and food poisoning.
That's why you don't eat gas station food, people.
Don't eat gas station food and do not eat rare chicken.
Don't eat under-seasoned chicken either, but they're still gonna do it.
I mean, yeah, but, like, I would want people to not eat undercooked chicken because undercooked chicken bad. You don't want Campylobacter jejuni. You don't want any of this. And I have been saying that this whole time. But okay, so it can also be caused by drinking raw milk or contaminated water. Also, some isolates can release cytotoxins that can cause direct epithelial damage or a cholera-like enterotoxin. The clinical course, so the incubation period for jejuni is going to be up to 8 days. The primary symptom is going to be it's going to be associated with like flu-like symptoms before the onset of watery diarrhea. And dysentery can develop in more than 50% of children and 15% of adults. Complications of this can be reactive arthritis in patients with HLA-B27, erythema nodosum, Guillain-Barré syndrome, or post-infectious irritable bowel syndrome. So again, we don't want any of this. This is all bad, again. And it will always be bad. Don't fucking do it.
What is the volume of 24.65 grams of iodine if the density is 4.93 grams
What?
per centimeter cubed? Number 7.
Number 7. Wait. Number 7. Mass in grams of... Oh, volume. Wait. So volume equals... Oh my god, I have to go... Oh, that's a deep cut now. Wait. Oh, so just multiply density times the mass. Or... Oh, no. Volume equals mass divided by density. Sorry. So... Basically, the volume is so...
The 24.65 divided by 4.93.
Yes.
Oh, okay, thank you.
Yep. I'm very bad at math, but I kind of remember. The volume is 5.
How much iodine is that? That feels...
5. 5.00 grams per centimeter squared, so ml.
Mm-hmm.
So like so basically once you do the calculation, once you're done converting it, you can like get rid of the grams and gram square, like grams and then the grams get rid of the grams with the grams over cm3, and then you're gonna be left with cubic centimeters. Cubic centimeters is equal to like, it's 1-to-1 with milliliters, I think, if I remember correctly. So it ends up with being like 5 milliliters. I think, if I did my math right. Give me like 2 seconds. I can do it.
Mm-hmm.
But I think I'm right.
Okay, so it's mass divided by density.
Yes. And remember, like, you get rid of the same units if they're on opposite sides.
Okay.
So you get rid of the grams, and you're going to be left with cubic centimeters. And I think cubic centimeters is equivalent to milliliters. I'm pretty sure. Someone can check me on that. Chat can hopefully check me on that.
Because I did this problem before, like like number 6, and
poggers.
It had the centimeters
Poggels.
cubed or whatever the fuck, and it equals the same number as milliliters.
Yeah, it does. Okay. Common symptoms of shigellosis. So we're going to have bloody diarrhea and abdominal cramps. Shigellosis also has Shiga toxin. The Shiga toxin is what causes the bleeding. And in children under 5 years old, you can have hemolytic remix syndrome. Primary reservoir for Shigella species is going to be humans. It's all humans all the way down. Mechanism of action in the cholera toxin is going to be stimulating adenylate cyclase, increasing the CAMP levels. The clinical course of viral gastroenteritis caused by norovirus. Incubation period of 1 to 5 with abrupt onset of diarrhea. This is the one in the cruise ships. Diagnostic test for cholera is going to be stool culture to isolate Vibrio cholera.
But how do I do the sig figs?
For sig figs? 5.00.
If the answer... Okay.
You just add the 0 at the end. So 5.0. 2 sig figs, it still counts.
Oh, okay.
Yeah.
That feels stupid. Because I feel like it increases the likelihood that you would accidentally read that.
No.
Really?
No.
I feel like someone fucked that up.
I have. But
like,
that was when I was younger and I didn't know science. Now I don't.
Fair.
Now I don't. I promise you'll get used to sig figs later. It sucks now when you're just learning it, but it'll be like second nature later. I promise. Just practice doing it. Like, doing a lot of these questions will help you. Chemistry is the one where it's like, chemistry is one where you do not memorize. You do. You do problems. Especially when you get into
Mm.
organic chemistry. Organic chemistry, you have to do mechanisms. It starts to make sense when you start practicing doing mechanisms and tracing through.
I don't know how much organic chem is in this. It's intro to general chem over the course of 14 weeks.
I understand, but like this is just in general. Like this is just general advice for like chemistry in general. You do the thing. You do the problems, but you memorize the periodic table because sometimes they're not going to give it to you because they're stupid. They should give it to you because like everybody gets this periodic table. Primary cause of pseudomembranous colitis is going to be C. diff. Giardia lamblia
Okay, I
is
have
going
to.
be diarrhea.
I have to go back to work.
Okay, bye.
Bye bye.
Rip. Rip. But okay, the primary transmission route for cryptosporidium is going to be in contaminated water sources, as we know. Ascaris lubricoides pathogenesis. Infection occurs through the ingestion of eggs, leading to intestinal obstruction, aka it's all bad. It's going to be all bad all forever. Infective dose for Shigella is going to be very low. It's like from 10 to 100. Parasitic gastroenteritis, SOP, so stool oviparasite. Primary symptom of enterohistolytica, bloody stools with mucus. Dysentery with bloody stools. Yeah, same thing. Pathogens of Yersinia enterocolitica is going to be invasion of intestinal mucosa, leading to inflammation. Common source of salmonella, contaminated food, especially poultry and eggs. Clinical course of Campylobacter. Oh, wait, what? I didn't mean to do that. I was trying to look at the end. Onset diarrhea, bloody with abdominal pain. Vibrio is going to be curved gram-negative rod. Virulence factor Shigella, production of Shiga toxin. Whipple disease, malabsorption leading to weight loss and diarrhea. Antibiotics and rehydration. Hemagglutinin is going to be the one that causes agglutinin, so like it attaches, so this facilitates bacterial attachment and shedding into the stool. Incubation period up to a week. 7 to 10 days of diarrhea, fever, abdominal pain. Progress from water diarrhea to dysentery, approximately 50%. Salmonella infections will persist for a month. Subacute, waxing, waning diarrhea, mimicking new onset ulcerative colitis. Triad of extraintestinal complications associated with salmonella, cerebral arthritis, urethritis, and conjunctivitis. So SUC, it's gonna suck. Or area under the curve, like for arthritis, urethritis, and conjunctivitis. Affects immune response, stimulates neutrophil chemotaxis, and potentiating mucosal damage. Mistransmission method for typhoid is going to be person to person or via food and contaminated water. Morphology of typhoid, most prominent in the left colon due to abundance of M cells, and the mucosa may be hemorrhagic, and ulcerated. Why am I still on this channel, actually? But okay, we're gonna keep going. Diagnostic test essential for diagnosing typhoid, stool culture. Symptoms of typhoid, anorexia, abdominal pain, bloating, nausea, vomiting, and bloody diarrhea. Rose spots are going to be small erythematous maculopapular lesions developing on the chest and abdomen. Primary cause of diarrhea, or traveler's diarrhea at ETEC, so enterotoxigenic E. coli. Toxin produced by ETEC is going to be heat labile and heat stable, so LT-ST. Stilt, ST-LT, stilt. Mechanism of action for labile toxin is going to be, it activates adenylate cyclase, increasing intracellular CAMP and chloride secretion. A mechanism of action for ST is going to be guanylate cyclase, increasing intracellular cyclic guanosine monophosphate, so CGMP. Pathogenesis of enteropathogenic E. coli. It produces attaching and effacing lesions that cause local effacement, basically local destruction of the microvilli. Most critical determinant of disease in Yersinia infections is going to be the frequency of antibiotic use and the effect on the colonic microbiota, because C. diff can be like outcompeted by your normal flora, but if you have no more normal flora, then they'll just go in. They'll just go in. The frequency of antibiotic use and its effect on colonic microbiota, I already talked about it. The typical demographic affected by non-typhoidal salmonella is going to be young children and older adults. Okay. Now we're going to keep going. The complications associated with non-typhoidal. Yeah, we already talked about this. Oh, wait. What did I read? Oh my god. Hi, Zeke. Hi, Mr. Manager. How you doing? Two seconds, though. I gotta get some water. Because I ran out already. Because I was drinking earlier. 2 seconds. Righty, I return. Oh wait, oh my god, thank you. I just noticed. I didn't realize. I thought I muted the Discord after. Thank you so much. And yes, I am doing okay. I woke up on time. Everything should be good. The only chaos here is the chaos that's in my brain, as per usual. But okay. I'm sorry! She had to go back to work. But yeah, she had to go back to work, unfortunately. Like, we were working on her chemistry with her together. What? She doesn't have to, but I appreciate it. She doesn't have to, though, but I really appreciate it. Like, all we're doing is this. Okay, the recommended treatment for non-typhoidal salmonella infections is just gonna be water. Rehydration. Salmonella's pathogenicity is going to be it invades M cells through adhesins and binds the host cell beta-1 integrins. The histologic changes associated with typhoid fever are going to be regional lymph node and Peyer's patch hyperplasia. Not hyperdysplasia, hyperplasia. Common sources of transmission for Yersinia infections is going to be most frequently associated to pork, raw milk, contaminated water. We're starting to notice some fucking patterns here. It's almost like raw milk is a very bad thing. And I'm gonna beg you guys not to eat. I'm begging you guys not to eat raw pork, improperly cooked meats, raw milk. Don't drink raw milk. Stop drinking raw milk. And do not drink bad water. And the symptoms of Peyer's patches, no, it is not healthy. It is not healthy. We all know it's not healthy, and I'm gonna keep preaching to the damn choir about this because I am correct. It's not healthy. No one will tell me otherwise. I refuse. Oh my god, I'm so excited. Yep. I mean, they stop your salmon from being picked. Okay. So, no. They don't. The Peyer's patches are like an important thing in like GI bullshit. But yeah, so the thing with Peyer's patches, it's just they're the initial site of invasion for salmonella. That's like why they're so fucking important. And that's why they're important for fucking salmonella typhi. Just important for salmonella in general, because like that they need a place to go to. It's like a USB port and the USB drive. The USB drive is the bacteria. The information in the USB drive is the toxins. Toxins go in, they attach to the port, which is the Peyer's patches. And in a way, it causes a patch. GI tract. Causing you pain and suffering. Which then leads to my main point of don't fucking eat this shit. The role of iron. So, iron enhances the virulence of your cilia and will stimulate systemic dissemination. Critical determinants of disease and intestinal infections. So, basically, the frequency of antibiotic use and its effect on colonic microbiota. Wait, what did I do? What did I do? Oh, I already said this. Yeah, I was supposed to click the other arrow, not the other one. But okay. The main organ is responsible for enterohemorrhagic E. coli. Wow. I fucking wonder. It's almost like it says it in the name. E. coli 0517 main layer and non-0517 H7 serotypes. It's the same fucking thing. Basically. To me, they're not the same fucking thing, but they're the ones that are doing the thingy. Wait, what? They're the ones doing the ehec. This is gonna be through contamination and consumption of improperly cooked ground beef, milk, vegetables, bad contaminated foods in general. Oh my god, it's you. Hi, hello, assistant Mr. Manager. How you doing? Also, oh wait, streaking as an I get it now. I understand. I understand. Also, Blue, I hope it's not a raw... No! I was about to say, I hope it's not a raw milk run. I don't think you can even buy raw milk. That shit's hard to get for a reason. So getting raw milk is not allowed. I do not allow it. But yeah, like getting regular milk is fine. Wait, so you're gonna get a fucking cow? Is that what you want? You want to get a cow? Crazy. Okay. Antibiotic treatment in heck is gonna be increased HUS. So increased hemolytic remix syndrome. Characterized as intera-invasive. This is gonna be big. They're like Shigella, basically. They are bacteriologically similar to Shigella because they both have Shiga toxin. One sec. I'm gonna open my water. I mix it with some Celsius, like powder. I mix water and Celsius powder, and it tastes good. What do you mean a cow man? Wait. What? That's real? That's real? People do that still? Wait. I thought like the glass jugs shit, I got the glass containers thing was like a thing from like a relic of the past. I thought that was like I thought those were like the before times. Before times. Like 70s, 80s, 90s. What? So you're telling me once I become a physician and I have attending money, I can just never drink plastic milk ever again and I can drink like glass milk? I can drink glass milk? I could get the glass milk. Wait, that's amazing. Wait, so there's just milk that comes in. Okay. Someone needs to help me find, like, that's crazy. Wait, now I'm curious. Now you got me on another tangent. Give me a second. Now I'm distracted. Glass bottle milk. USA. What? Wait. Okay, dumb question. How do you know if it's like clean milk and not like evil milk, like raw milk? What is like? How do you know if it's? Oh, okay, it's pasteurized. Whoa, that's so cool. This is amazing. Oh. That's awesome. What the fuck? This is crazy. Wow. They even have juice? They have juice and other beverages? This is adorable. Sorry, I'm getting so distracted. These are so cute. Okay, I need to stop looking at this so I can get back to work. Shit. Okay, common symptom of PIEC infection is gonna be watery bacteria, abdominal pain, and cramps. Everything's gonna have bacteria, or everything's gonna have diarrhea. It just depends on like what's gonna be diarrhea plus etc etc. That's so cool though, the milk thing though. What the fuck? That's amazing. Okay, we're gonna continue though. What is Whipple disease? Who is most affected? A rare multivisceral disease causing malabsorptive diarrhea, most common in males of North European descent. So, like, white people. Rotavirus is going to be diarrhea, weight loss, arthralgia. Active dose for rotavirus 10. Norovirus infection is going to be diarrhea, vomiting, abdominal pain, fever. So, literally, they all are the same depending on the, like, all of, like, if you didn't know if it was viral or bacterial, it's basically, you're all too fucking similar. Incubation period for norovirus 1 week. SARS-CoV-2, 50% report with GI symptoms, with 15% representing GI as chief complaint. That's actually that's dead ass real, because like that's what I've seen a lot of. That's what I used to see a lot of when I was like working at like in the hospital with my doctor boss. Like I was the one taking all the notes down, but like there were some patients that just had GI symptoms, and this was in like 2020, like 2021. And so this is like when we were still reading things, and it was like, oh wait, some COVIDs have like, I don't remember, like 2021 or 2022, but like basically in that period when there was still like the emergency, the state of emergency for COVID. Basically, they were like, we were noticing like, hey, and also like we read it, like there was a lot of stuff going on where there were just patients with GI symptoms, but they would still have COVID. So you would have them get tested for COVID, and lo and behold, it was COVID. So I saw this a lot. Like there were a few patients that would only have GI symptoms as a chief complaint, but they were around people that had COVID. So it's like, maybe COVID. And it was COVID. COVID bad, by the way. Don't get sick, please. Don't get sick, please. Please don't. COV2. Thank you so much. I am sipping some water. ACE2 and TMPR SS2 receptors. Clinical course of viral gastro is going to be, they resolve in like 2 to 3 days. So in a way, they're usually self-limiting. That's the real thing. So dense accumulation of distended foamy macrophage in the small intestinal lamina probe. God, my water. This drink is so sour. God, this drink is so sour. I should have added more water to it, because like most of my water froze. So like it is delicious because it is hyper concentrated, because like all the stuff that's coming out right now is like the Celsius mixed with water, so it's mostly flavoring, but also because it's mostly flavoring and caffeine and delicious flavor, it is also really sour and really concentrated, and it's, ow, my mouth. Crazy. Crazy. Okay. So basically, wait, what? What was I doing here? I was trying to like say the thing. The diagnostic test for C. diff is going to be testing for the toxin, not the culture. EHEC is going to be for cytoskeletal disruption. Toxin-mediated disruption of this epithelial skeleton will lead to barrier loss and apoptosis. Fatal complication is going to be toxic megacolon. Shaggy mucosal surface it causes bilious expansion because of dense macrophage infections. Risk factors for C. diff: antibiotic treatment, advanced age, and hospitalization. Okay. Role of the FUT2 enzyme in SARS-CoV-2 is going to be it fucosylates plasma proteins in the Golgi apparatus, serving as binding sites for the virus. Transmission route is going to be contaminated food, you eat egg. Or direct fecal oral route. But basically, you eat shit. In the end, you eat shit, and then you eat the weird shit. But okay. Direct fecal oral route. How long after infection can Ascaris lumbricoides symptoms appear? So basically up to 8 weeks after infection. Enterobius Scotch tape test. Cellophane tape to the perennial skin to identify eggs. Schistosomiasis is going to be infectious larva penetrates the skin, migrates to the lungs, and matures in the intestine. Strongyloides is going to be autoinfection with larva penetrating the skin and migrating to the lungs and intestine. Hookworms is going to be basically breaks through the barrier of the skin, migrates to lungs, mature in intestine. Clinical features of intestinal cystodes, so superficial erosions, focal hemorrhages, inflammatory infiltrates, and iron deficiency anemia. Infectious dose for Giardia is going to be 10 cysts, as the floor is 10 cysts. Transmission route for entamoeba is going to be fecal oral. So like basically now we're going on to the shit mouth, poop mouth route. It's almost all of this is going to be poop mouth route. Characteristic lesions caused by Taniosolium are going to be the flask-shaped ulcer. No? Flask-shaped ulcers happen in Entamoeba histolytica. Pathogenesis of Cryptosporidium attaches to the brush border. It induces apoptosis. Yes, basically, wash your hands. Do not eat poop. Do not eat tapeworms. Make sure you are clean. Your hands are important. Your body is important. You only have one of them. Take care of it. Main clinical feature of Diphyllobotrium latum is going to be B12. B12 deficiency and megaloblastic anemia because of the B12 deficiency. But yeah, basically wash your hands. I mean, yeah, until we become cyborgs, we only have one. But I feel like the cyborg hot take here. I feel like the cyborgs aren't going to be something that we as normal people will have access to. Unfortunately. Because we still have like a billionaire ruling class. Basically puppeteering everything. So this is gonna be the closest I will get to being to becoming a cyborg. Becoming a VTuber. That's all I am. This is the closest I'll get. I feel like this is gonna be the closest I get to becoming a cyborg. Because at least with this, I have multiple bodies. I do have multiple bodies. So that's cool. Honestly, if I could insert my brain into my model, I think that'd be a really weird life. Because, like, I can't... So, as a VTuber model, like, as a 2D model, I can't really do anything other than wiggle. I can't even step. Can't even really eat. Like, I can't do much. That's all I can do. I can't even step. All I can do is pivot. I can do this. That's it. I can wiggle. Well, I can do this too. I can do this. But that's kind of it. This is kind of it for me. Like, as a VTuber model? Unless I get a better model that allows for movement. But until then, I'm just this. This is all I got. Primary method for diagnosis is going to be detection of larvae in the stool samples. Pathogenesis of Giardia is going to be infects the intestinal epithelium and causes diarrhea and malabsorption. Upgrades, people, upgrades. Exactly. Hence, I must get upgrades. Hence. Hence why most of anything that I get from streaming is going to go straight back into the stream. Until I can invest it in more than just the stream. Yeah. Basically, eventually, if this ever happens, if I ever get a 3D model, I'm gonna go insane. Though that means I have to figure out like how the hell to do trackers and shit. Like, I don't know any of that. I'll have to like ask my other friends like who do 3D VTubing and like ask them for help because I don't know. I don't know jack shit. I don't know jack fucking diddly squat. I don't know any of that. I'll learn. Okay, back to this. The role of the inflammatory response in hookworm infections, basically, it's necessary for the passive transfer along the intestine, allowing eggs to be shed in stool. Primary clinical feature of Enterobus vermicularis, itchy asshole. Itchy asshole. Itchy asshole. Always itchy asshole. We don't want an itchy asshole. We don't want pinworms. How do schistosomes migrate after penetrating the skin? They go through peripheral vasculature and lymphatics to the lung and heart. Infected dose of cryptosporidium, I think it's pretty low, right? Yeah, it's like it's like 10. Like for Giardia, this one, and I think Entamoeba histolytica, it's 10. I think. The significance of the eggs produced by female hookworms, it's gonna be they elicit localized inflammatory reactions necessary for egg migration. Common symptoms of amoebic colitis caused by Entamoeba histolytica. This is gonna be bloody stools with mucus, so diarrhea with mucus and bloody streaks. We're going in the for the intestinal ulcer character. Going to be like anchovy paste consistency. They're also going to be flask shaped ulcers, and you will also have ulcers going on in the right lobe of the liver. I mean, yeah. Also dysentery, cramping, abdominal pain, and anorexia. Diagnostic method versus intestinal cystodes, proglottids and stool. Complications associated bowel obstruction probably. And also acute necrotizing colitis and significant mortality. Amoebiasis, flask-shaped ulcers. Steatorrhea and foul stools. Yeah, causes acute self-limited diarrhea. Okay, I mean, yeah, they are self-limited as long as like but you should still kill them off. You should still kill off like the fucking thingies. You still need to get rid of the Giardia, and for that, you give them metronidazole. You must. Like. Strongyloides, unbroken skin. Trichuris trichura, clinical feature. It infects young children and may cause bloody diarrhea. Diphyllobotrium latum, raw or undercooked fish containing encysted larvae. Enterobus vermicularis, itchy asshole. It's all itchy asshole. If it's pinworm, you're gonna have an itchy asshole. If you ever feel like you have an itchy asshole at night, well, if you feel like you have an itchy asshole at night, well, might I recommend you put tape on your asshole and seeing what you find? Let's do memorize it all. Okay, wait, so we're gonna go as fast as we can on this one. So cholera. Patient period days. Diarrhea associated with cholera is gonna be rice water. Complications of cholera. This one. Dehydration, hypotension, shock, death. Transmission is going to be raw chicken. Campylobacter jejuni. Few is 500. Sit for parasitic cyst is going to be smaller. Oh, I can just press enter 1, 2, 3, 4. Okay. Shigellosis is going to be shigotoxin, so that's going to be 2. Primary reservoir is going to be... Oh, wait, 3. Oh, God. I didn't mean to press 2. I fat figured that. I meant to press 3. Cholera is going to be... increasing CAMP, so 4. Hallmark of cholera. What? What do you mean? Like... what? Like, just the usual? Oh, severe secretory diarrhea due to, like, beat up B1 or something? I'm not typing it. Skipping it. Oh, it's just caused by toxins. I'm not writing that down. You were correct. I'm not writing the whole word out. I'm not writing the whole word out. I am lazy. I am lazy. So 8 days. Secretory. I am right. Let's do this again. Okay. Rice water stool. Dehydration. Shock. Muscle cramp. This is gonna be transmission route is gonna be undercooked chicken. Chicken. Effective dose 500. Shigellosis is gonna be... oh my god, everybody's cheating right crazy. Abdominal pain, diarrhea, cramps. Yeah. Diarrhea, abdominal cramps. Okay, let's continue. Reservoir for Shigella, human. Cholera toxin. Adenylate cyclase. Same fucking thing. I'm not typing all that out. Okay, clinical course of viral gastroenteritis caused by norovirus. This is gonna be abrupt onset. Is gonna be 4. Cholera 4. What? Lev! Hi! 6'7"? 6'7"? What? Oh my god! Hi! Hi, you guys. How are you guys doing? Oh my god, thank you for following, firstly. I am saying something. I am saying 6 and 7. 6 and 7. You're welcome. Do you want to know the primary cause of pseudomembranous colitis? The primary cause of pseudomembranous colitis is because of C. diff. Also, where are the rest of them? Also, hi! Hi! Hello! I didn't realize there was an ad, though. How do I dismiss the ad break? But, hi! Hello! Hello! How are you guys? What? Why are you guys scared? Hello! Why? Wait. Wait, why are you guys scared? What have I done? What have I already done? Hello! Hello, welcome. I am... Lev probably already mentioned me, but I am Spectral Anomaly med student, VTuber, and you guys are not allowed to have tapeworms, but you guys are like permitted to have water. You guys need to drink water or else like you get diarrhea, or actually or else you get like constipation and pain and suffering. And you are not allowed to have medium rare chicken. You are not allowed to have tapeworms. You are not allowed to have raw milk. And that is not allowed. I do not allow you guys to do that. Please. You don't want to deal with the problems. You don't want that. Please. Please. That's not good for you. I am begging you. You don't need it. I promise. I promise you don't need it. Medium rare chicken is bad. Lev. Lev. What have they done? Why? Hi. Why? Y'all. This is the opposite of what I've been telling you. Please. But yeah, the main cause of this is C. diff. C. diff. Common causes, this is gonna be diarrhea, abdominal pain, bloating, but also no. You need to have fully cooked wait. Eat milk frozen? Isn't that just ice cream? Wait, isn't okay, wait. Isn't it's freezer broiled milk? Wait. Why would you want that though? Milk ice, isn't that just ice cream? Cause why do you want to eat mice? Why? What happened? What no! Please, no! What the hell? I'm allowed to say hell. I'm like allowed to say hell because technically that's in like the PG-13 rules of swearing. Hell is allowed. Do not eat mice. Okay, fair enough. It just has it does have sugar, full fat from cream, not just milk. But can't you make ice cream with milk? Probably not very good ice cream, but can't you? Like, I don't know, maybe. But your guys are not allowed to eat mice. You can't eat ice cream. That's allowed. Ice cream made with pasteurized milk. Yes, what's your question? What do you need my opinion for? No mice. Wait. Should a Bluetooth computer mouse be called a hamster? Honestly, like, that makes sense. I don't... Yes? Yeah? I mean, wait. I thought... but... Oh, you legally would not be able to make ice cream. You need a percentage of dairy fat to call it ice cream. Oh, but like... So, okay, wait. Now, I got distracted. Firstly, I guess you could call, like, a Bluetooth mouse a hamster. But also, secondly... Mocha, why are you already tired? Isn't it, like, afternoon or morning for... What time is it for you? Hi. Hi, how are you doing? You just... You had a... It's 8 p.m. Oh my god. Oh my god. You slept since 2, so it's 2, 3, 4, 5, 6, 7, 8. You had like 8 hours of sleep. You had like 6... I don't know how to count. Wait. 6 hours of sleep. You should be fine. I don't know, stretch some more or something. Or like sleep in a little longer. Wake up at 11 like I do and then stream. I'm joking, don't do that. Unless you want to be like me. But what? Well, like you asked my opinion. What do you mean? Why am I trying to get WD-40? Wait, Mocha, you missed it, girl. Mocha, oh my god. The ortho doctor was in my chat earlier today. You could have asked him questions. You could have asked him questions. Yeah. Oh, also, like, he got recorded his stream about, ankle. Yeah, you could have asked him to explain tibial fractures. Though, like, he did say, like, if I had any questions, like, I could ask him. So, like, you should ask him. You should ask him questions. He's really cool. He's ortho. Like, also, wait, I have to shout out Lev. But yeah, like, girl, message him. Like, I feel like you just need to message him to, like, let him know. Because, like, girl, you could have, like, he was here. You could have, like, asked him questions. You could have, like, oh, Giardia Lamblia is like, yes, it's my favorite little guy. It's this guy. Yes, I have an emote of him. It's pogging. It's a pogging Giardia. Wait. Oh god, I hope I didn't kill my stream element. Oh god. Chat, I think I played a dangerous game. Trying to use my chat on Twitch. Hello? Hello? Wait. Yeah. Wait, is it working? Okay, it worked. Amazing. Hi! But yeah, like, I have a Giardia emote. It's my favorite little guy. I was trying to, like... Thank you so much! I am glad you liked it! I am very happy that you liked it. Hi! Hello, Lev. I am so happy it worked. Yes! Yeah. Oh yeah! Oh yeah! Yeah, we will be doing that. My time, like this time. Yes, let's learn about Say Gex. We're gonna learn about Say Gex. And by the way, according to Blue, we don't have to like use the mature filter because all we will be doing is talking about sex and sex education, and no actual like porn or like sexual material will be like present. So it works out. And honestly, I felt like this would be I felt like a sex ed stream would be a good time for you to talk about heated rivalry. I thought it would be the perfect time for you to talk about heated rivalry. Lev, what do you mean? Exactly. See, you're getting it. This is like, that's the perfect time. That's the perfect time. You're getting it. What? Wait, that means we use the mature filter. Okay. But yeah, like... Okay. I mean, look, I didn't know. If that was gonna be the plan, I would go with it. That's fine. I would happily go with it. Because it's like, I don't care. I'm just having fun. Like, I know! Oh my god, though. I even found, like, a free stinger. I found a free Valentine's Day stinger, and I have to send it to you, because it was for free. A 4-sided dice. I do in person. I have a D4. Why? Do you, like, want me to roll it? Okay. I will roll the D4. I actually used to have, like, 1 minute. There's like an online roller. Wait. I'll roll it right now. I'm rolling it right now. Get rolling. What the fuck is this? What is stream roll? Oh, whoa, is it overlay? Interesting. I got a 2. Why? We got a 2. We got a 2. What do we do with the 2? Is that good? Is that bad? I don't know. What is option 2? Oh, on this. I see. Yeah, it is 2, by the way. And look. Oh, girl, thank you so much. You're like so smart. 1 minute. Oh my god. Let's go. Let's fucking go. Okay, the primary transmission route for cryptosporidium is through contaminated water sources, because a properly cooked chicken, that's going to be salmonella, and that's going to be campylobacter. Contaminated food including poultry and eggs, salmonella. Number 4. Okay. But the answer is 2. It's still 2. But I'm going 2. The pathogenesis. Wait. What do you mean? Wait, I'm confused. She said that she was gonna claim me as a child. What do you mean? I don't know what's happening. What custody battle am I in the middle of? Ascaris lumbricoides is gonna happen through skin penetration. But we can press 3. I'll press 3. It is wrong. It's number 2. Ingestion of eggs. Oh, Strongyloides is 3. Or Strongyloides is 4. What? Wait. Huh? What? Why? What? Okay, wait. I'm so confused. What? Why am I in a custody battle? What have I done? What have I done? What is happening? I don't know what's happening anymore. I see. I don't know who found me first. Wait, what? I mean, in all honesty, it was probably a pretty quick delivery, considering that, like, Would ghosts have, like, a very hard delivery? Thank you, Kimmy. Thank you, Kimmy. I mean, we can do a Punnett square. We can do a Punnett square and find out whose genes. Okay. I mean, technically, by way of, I mean, in that case, by way of pedigree, I would still be both. So in the end, yes, the answer is yes to who is parent. I think. I don't know. I'm not the doctor yet. What the hell am I going through? What is what the hell? What the fuck? Who is adding me? Whoa. Yeah, legit, Vanny. I don't know either. I don't know. I think you got here after Lev. Like after Lev. I don't know. I don't know. I don't understand. I don't know what's happening. All I know is that I'm here. So this is gonna be like for Shigella. Shigella, I think it's this. Oh, it's 100. Oh, it's 10 to 100. I got it wrong. Okay. Yeah. Yeah, I'm getting very confused. Ascaris lumbricoides is gonna be through skin penetration. Oh, ingestion of eggs. Fuck. Okay, that's okay. It's okay. I am studying. Don't worry. I'm just having fun. Technically, my exam was on Monday, and I have, like, so many days to study for it, so, like, I can chill. I mean, true. That just means you need to get more of your own. And for infective dose, it's going to be 1. extremely low. For Ascaris and Vercoides, ingestion of eggs. Finally. In common diagnostic test for bacterial parasitic, this is going to be SOP, which is still my 13th reason. And to be... No, legit, I don't understand, like, how that streak has been going on. Like, dead ass. We're not getting tapeworms. Kimmy, please. Please, we're not getting tapeworms. I'm sorry. That is not allowed. I am not allowing this to happen. I refuse. Lev, tell them not to. Please. We're in Team Histolytica. This is going to be mucosa. This is 0 bloody stools. Rats! Rat soup! No, legitimately. This is how you die. It's a rat, Mr. Manager. Okay, pathogenesis of Entera has to... Fuck. This is gonna be... Yersinia enterocolitica. This is gonna be 4. I mean... clinical course of viral gastroenteritis caused by norovirus. So, like... 1 to 3 days. Incubation. Acute diarrhea. Well, yeah. You're not allowed to... Yeah, 1 to 5 days. Abrupt onset. Yeah, acute diarrhea. Abrupt onset of diarrhea. Primary, because it's gonna be, Vibrio culture. Okay, cause of pseudomembranous colitis, C. diff. I said... Okay. Okay. Quizlet, what do you mean? What do you mean? Quizlet, I am correct. C. diff, Clostridium difficile infection. It's C. diff. Same damn thing. Yeah, also, Lev, absolutely, so that I can join you, and then I can get questions wrong, and then you can teach me, which will help you increase your learning. I think that would be fun. I think that would be fun. Also, oh my god, wait, you have to study for boards now? Oh my god, good luck. Do you use UWorld or no? I mean, maybe... Don't judge my spelling. Pathogenesis of Ascaris and Vercoides. Pathogenesis. Well, did it miss me again? Again? That's crazy. Why does it keep missing me? Pathogenesis of Ascaris and Vercoides. Oh, it hit? Oh, cool. I didn't hear it. Oh, wow. The pathogenesis of Ascaris and Vercoides. This is gonna be digestion of eggs. Yeah, intestinal obstruction. That's like the end result. Infective dose is gonna be 10 to 100. Parasitic gastroenteritis, stool ova parasite. And yes, it will block the poop chute. Primary symptom is going to be dysentery plus bloody stools. So technically they say both. They say like diarrhea or bloody diarrhea with mucus and streak. With like, they say loose stools with mucus and bloody streaks. So basically the same thing. Yeah, close enough. I got it. I know I got it. Yersinia enterocolitica. Yersinia enterocolitica, this is going to be... Oh boy, what are you again? Unpasteurized milk. Unpasteurized milk. Don't. Well, basically close enough, because like invasion of intestinal mucosa lead to inflammation because of ingestion of unpasteurized milk. I'm still correct. Common source of salmonella infection. So there's going to be contaminated food, including poultry and eggs, especially poultry and eggs. For Campylobacter enterocolitis is going to be this one. Vibrio cholera, curve gram negative. Shigella dysentery. Primary violence factor, shigatoxin. Shigatoxin, that's why you can get wait. You can get HUS this way, like hemolytic uremic syndrome this way, right? Also, remind me? Wait, how do I add more VIP? I'm making more people. I'm doing this. Okay. Don't worry, this will make sense. It's gonna keep happening. What am I doing? Yay! Awesome! I never could handle the taste of Rockstar, but they're cool. That's cool. Hell yeah. Okay. Whipple disease. This is gonna be malabsorption leading to weight loss and diarrhea. Treatment of bacterial gastroenteritis is going to be 3. Rehydration and in some cases antibiotics. Antibiotics are good in some cases, but in a lot of cases you're just going to have like the carrier effect. So I still can't. I've never tried that one. Honestly, my third favorite energy drink was Bang. So if I were to like do a tier list of energy drinks, my first one and my Roman Empire is still going to be the Panera Lemonade. The Panera Lemonade. It will always be the Panera Lemonade. That one lives rent-free in my brain. The second is Celsius. The third is Bang. Fourth is like White Monster. Fifth is Mango Monster. And that's it. And then sixth is the Celsius that's in like the little powder packets. Incubation period is like for this one, this is gonna be like 3 up to a week. Common symptoms of salmonella infections is gonna be like, I never liked the original monster. I didn't like the green monster. What, 2 to 3 a day? I can't even judge you because I can't judge you. I cannot judge you. I used to drink like 2 to 3 Alani a day. I cannot judge here because I am bad with alcohol, with not alcohol, with energy drinks and caffeine. I'm very much addicted. This is gonna be a 3. Green apple taste. Wait, they had a Lev energy drink this whole time? Crazy. Oh, by the way, Lev, did you notice that there is an apple stem on your head? Did you notice? I hope you noticed. Hi! Oh my god. Hi, Diplodocus. Welcome to the stream. I'm studying pathology. Currently, I'm going over GIT infections. What is your area of interest? Is it pathology? I mean, true. All things are possible, but like, it's still gonna be like approximately 50% because there's because like, yeah, it's gonna be 50% here. So it's gonna be 1. Common sources of salmonella infection. Contaminated foods. Poultry, egg. Huh? Wait. Oh god. Oh god. Hi. Hi, Peachy. God. So. Okay. Oh god, clinical course. Hi. I mean, wait, Lab, why is your model getting lobotomized by a tree branch? That is a bit of a concern. Okay, course of Campylobacter. Wait, can you hear me? Hello? Hello? I'm gonna go as close to the mic as possible. Can you hear me? And can you hear the music? Okay, cool. Diplodocus, can you hear me? Hello? Okay, cool. Awesome. I was like, hello? Hello? I am spectral anomaly. I am studying pathology. I hate pathology. Oh god, Campylobacter enterocolitis. Fuck, I don't remember. Oh, abrupt onset of diarrhea. Oh, bloody with abdominal pain. Well, eh. Gram-negative curved rods. Primary violence factor of Shiga toxin. Ah. Thank you, Sarybot. ABX depending on the case. Adhesion. This is the same. Bacterial. It's the same. Incubation period for. So this is gonna be 1 to 3 days. I was incorrect there. That's fine. Salmonella infection is gonna be abdominal pain, diarrhea, vomiting. I think. Less vomiting, possibly. I don't remember. Oh, fair enough. That's fine. Okay. I'm continuing. 50. I wrote in 50. Constitutional signs. They may persist for a month if you have dysentery. At that point, once you have dysentery, you're just kind of like stubborn out. Oh! Here we go now. Oh, interesting. Yeah, that's weird. What happened? Yes. Yes, Vanny. Yes, Vanny. You're not allowed to have raw chicken or medium rare chicken. You eat fully cooked chicken. Salmonella. Just because it has salmon in it does not mean it is just fish. I'm gonna tell you that right now. It's not just fish. It's mostly poultry and egg and any other contaminated foods, which can be. It can be sometimes. It can sometimes be, sometimes be the other one, but it's usually gonna be chicken. Usually gonna be poultry or eggs. Oh, this is gonna be. I agree. Oh, it's 3. Oh, okay. It's only okay to eat raw eggs in Japan because they actually, test and make sure that the eggs are not contaminated with salmonella. Because it depends on the chickens. If the chickens are infected with salmonella, they can pass it on to the eggs. And princeps, no, not allowed. But also Diplodocus, why are you interested in this? Is this because do you do this stuff for work? I'm just curious now. And you should not season them with tapeworm egg. Oh, I am doing this because I am in med school. I'm in my 2nd year. And I am struggling through pathology against my will. I hate pathology, but I am doing it to pass. I hate pathology. I hate pathology. It's like a week. But yeah, I am a med student, VTuber, and chronically tired, and caffeine addicted, and studying pathology. What? Vanilla, you've got to be shitting me. Actually, no, you're not going to be shitting me. You're going to be shitting your brains out if you drink raw milk. That's the answer. Subacute. This is going to be waxing and waning diarrhea mimicking new onset ulcerative colitis. So, here's the thing. I think I'm gonna say I do not believe that AI is gonna make any of this unnecessary. Because firstly, AI isn't gonna be accessible everywhere. Like, imagine like where I live right now, where I'm going to school, there are places that are very rural. There are places that are very far remote. Like to the point where you have to go there by boat ride, by like a day's boat ride just to go there, and there is no internet there. You have to be able to know this stuff regardless. I don't consult AI. I've never used AI. I don't use the AI. I read. I do my best. And yeah, I don't like AI in medicine because many reasons, many reasons, mainly because people have been using this shit as a crutch, and I do not like that because that's just going to lead to worsening patient outcomes. Number one. Number two, I do not like the use of AI in medicine because they don't understand what we are seeing. Like, they understand like the basics. AI don't really have any sense of comprehension. They look at things like, well, let's say generative. Let's just say learning language, like LLMs. Let's just talk about large language models. They approximate answers. They like scour resources from things that they have already been trained on to regurgitate an answer. But they don't actually know if that answer is true or not. They're just feeding you back something. So it's like, it's really the person that has to go through the learning. I mean, except, yes, in a way, we do indeed do that, but the main thing is just that we are still able to learn. We are still able to learn from things. Yes, exactly. Thank you, Vanny. And like, he's a programmer. Vanny's a programmer. I'm trying to be a physician. Using like, if we just focus on large language models and they use in like, let's say just clinical patient care, the AI can be wrong, and they are wrong far more times than like a person. Yes, you may have isolated cases where yes, this doctor may have fucked up once, but also, yeah, that too. It's made by fallible people and it's going to be imperfect as well. But humans can still improve. And humans can still improve for like far less like ecological impact than an AI robot, like an AI bot. If I'll make a whole thing about like why I hate AI. I'll even write it on stream. I'll do that one day. Like, just remind me. It'll be on the schedule, like, I don't know, fucking in March or something. I don't fucking know. But, like, and yes. Also, because, like, they can't use, like, non-clean water. Because they use, like, the clean water for cooling, but then that pollutes the water, which makes it non-potable and not useful for us. And it's like, in my own conscience, for my own conscience, I am not comfortable using AI. Like, I do things slower, but I am happy doing things slower If it means that I am not causing that much ecological impact, and also I'm still learning the things anyway. People may be learning things faster than me, but I am learning and I am solidifying my fundamentals. And I don't need a robot to fucking do that shit for me. I don't need a fucking robot. You know what I do when I have a question? I literally just type out to Lev, or I type out to Psychen, or I type out to other doctors. Also establishing community and learning from them, learning from people with prior experience. Because I don't know. Also, I don't know, dude. AI just feels real. AI just as a thing is really isolating. Because a lot of the things that they make, a lot of the things, and like if we just isolate this and talk about LLMs, like large language models, like ChatGPT, Gemini, all those motherfuckers, where you give them something and they generate something back for you. Yeah. They're very isolating. They do things, like they act nice. They have that sycophancy built in to make sure you stay on that platform. And it's like, why would I want that? And why would I want to be away from people who I can learn from instead of just asking the people that I can just learn from? Like a lot of my classmates in school, yes, they do depend on the I mean, you're entitled to your opinion. But I'm going to continue. Extra intestinal. This is going to be SUC. So sterile arthritis, urethritis, and conjunctivitis. Okay. And also, like, why would we hope for that? But I digress. Back to pathology. Salmonella affect the immune response. So it stimulates neutrophil chemotaxis into the intestinal lumen potentiating mucosal damage. So it's going to be 2. I mean, yeah, exactly. And it's like, if we're going to use it as a tool, okay. Like I don't like generative AI. Let me make that clear. I do not like LLMs. I use things with machine learning. Wait. Actually, question. Does SPSS, like statistical package for the social sciences, do they use? I mean, it uses machine learning, right? And that too. Because like, I mean, because like I love SPSS. I use that daily. SPSS is the industry standard for doing social science, like social statistics, etc. And I love SPSS. I use that daily, especially for like my statistics work in school. Because firstly, I'm not gonna write all that shit out on paper. God no. Like, and I agree. Complex code counts as AI at the end. I mean, I don't really know because I don't build this shit. I just have to deal with stupid people in my class using it and getting stuff wrong. And then leading to people's grades, like my grades, getting lowered on group projects where they use an LLM to make up some bullshit to put in our paper, and then I have to go in and fix it before they accuse us of academic dishonesty. Okay. Kimmy, I'ma just say, the answer to that is all no. No. Tapeworms are not good for humans. I'm just going to say that much. They may be good in general for other things, but in humans, no. No, I do not like tapeworms. I am tapeworms' ultimate op. I am their ultimate op. Girl, I cannot believe. Why would you do this? How dare you? My lord. Oh, my lord and my god. Oh, my lord. Also, I'm so sorry. I still haven't like set up the like zoomy thingy in yet for this model, so I had to do it manually. But okay, basically the thing is with the tapeworms, let's just stick to the tapeworms here. Tapeworms may be good as an organism, but they are not good for humans. And that is why I do not like them. They are not good for humans. And if you live in places where you don't have to deal with tapeworms, good for you. Amazing. Damn. You're very difficult, aren't you? But no, like, also, why would you lose? Why would you let the tapeworm eat all your food? I mean, I'm not being mean. I'm just telling you the truth. It's not an ad hominem to the tapeworms. Tapeworms are just not good for human outcomes. And also, I'm never changing my name to Spectral Tapeworm. That is not allowed. I'm like never doing that. No, that will never happen. Also, like I don't even know how to like change my VTuber name. I don't know how to change my Twitch username. And even if I did know, I'm not doing that for that purpose. And yes, exactly, Blue. I don't like tapeworms on the basis of health. But Blue doesn't like tapeworms on the basis of that's like a disrespect to the food that they make. Exactly. I completely agree. And it's like, why would we want them? We don't need them. We don't need them. I promise you. We can survive very well without tapeworms. Honestly, we survive very well in spite of tapeworms. And with that in mind, I'm gonna go back to my other model. Mother, if you wanted to diet, like, there are other ways to do it. There are other ways to do it instead of using tapeworms. Or GLP-1s, honestly, because I don't really like, oh god, that goes into like another thing. I mean, no. I mean, okay, so here's the thing. There are a lot of tapeworms and other worms that exist without using humans as a definitive host. I am only talking about the pathogenic ones that cause disease in humans because I am in med school and we talk about diseases in humans. That's like my whole thing. I like don't understand where the problem is here. So I'm like, no. No, no tapeworm, not even a little one, not allowed. Not even a little tapeworm. You're like, not allowed that. No. Completely not allowed. No, you are not allowed that. But okay, back to this. Wait, huh? Oh my god, bro, oh my god. Another one? Thank you. I did not realize that you were here. Thank you. Wait, what? Wait, what? You can do that? Huh? Anna? Okay, medically assisted tapeworm therapy, Nature's Ozempic. Okay. You're not talking about the other Nature's Ozempic, C. diff. Do you want C. diff? Do you want C. diff? And, like, if you want C. diff, that's another kind of Nature's Ozempic. Is that what you want? Do you want that one? Because if you want that one... Exactly. Like, you're just making the problem worse. It's like, oh my god, that reminds you of the fucking dude... That, like, reminds you of the fucking dude Clavicular who used crystal meth in order to, like, stay skinny. You're solving a problem by giving yourself worse problems and making your life worse overall. You can literally see that dude disintegrate. Right? It's crazy. It's crazy. Like, why are you doing this to yourself? Yes. It's not just me who's seeing that. Thank you. I have my brain. It's been in my brain rent free. I've been seeing that shit constantly, and I'm like, why are you doing this to yourself? Why do you like this? Literally, like, no joke. He looks crazy. Honestly, Danny, don't you freaking dare. No. Not allowed. No. No. Why are you on Team Tapeworm? My god. Okay, typhoid fever. Fuck. It's 3. Human to human or... Ah! See? That... Wait. I mean, yes. But damn. That's such a boomer joke, though. Blue, that's such a boomer joke. What? Typhoid fever. M cells. 3. I mean, I know you bought a Rockstar earlier, and you also bought milk. That is not raw. You bought regular pasteurized milk, which I am proud of. 10 out of 10. Keep it up. Test for typhoid fever. I'm pretty sure that is stool culture. Hi, Kimmy! You're not allowed to have cocaine or tapeworms. They will fuck your body up. I am not allowing that. That is bad. Okay, wait. Twinkie, you don't even need regular cocaine. You can just take Ritalin. Same receptors. Don't do this. Don't do this. Do not do this. I'm joking. I am joking. Do not do this. Disclaimer, disclaimer, disclaimer. Disclaimer, disclaimer, disclaimer. Do not do what I just said. Only take medications. Only take medications prescribed to you by a physician. That is all I can say. Blue, what do you mean? What do you mean your streamers are dumb? Am I dumb? Am I dumb? Am I dumb? Okay, fair enough. But no. Tramadol, I mean, if you're prescribed it. I mean, if you're prescribed it, it's fine. I don't, like, if you're taking it as directed, I don't really care. I'm not your fucking doctor. Fanny, what? Huh? I'm so confused. What's happening? I don't know what's happening anymore. Typhoid fever. Shit. I mean, yeah, Coke used to have Coke. Also, like, don't snort Coke. That shit has fiberglass. That is one of the many reasons why, like, your septum just kind of eats away at itself. Pretty sure the other reason is because, like, it has the vasoconstrictive effect, and, like, the consistent vasoconstriction is just going to lead to avascular necrosis of your septum and of your nasal tissue. I'm pretty sure that's, like, the main reason. Though I'm gonna, like, double check on that. I gotta double check on that. I gotta double check on that. Gross spots in the context of typhoid fever. 3. Traveler's diarrhea. Etek. Because I have had this. I have had that. No! You should not have the Coke at all! Wait, Snow! Bro! What? Get a fucking HEPA filter, dude! You have a HEPA filter? Or an air purifier? Get an air purifier! Wait, they don't have like, they don't like, what? That's so scary. Oh my god, crazy. So signs and symptoms, oh wow, crazy. That's crazy. Coke and Coca-Cola. Honestly, I don't know. I thought Coke was just the shorthand form, like the shorthand form for Coca-Cola, but it's the same drink. I'm pretty sure it's just the same drink. Yeah, I thought that's same. I thought that's the case. Septic arthritis, it's SUC. So then there's sterile arthritis, conjunctivitis. Okay. I know it's SUC, but I forgot now. Look, I don't know this shit. Ask me about like medication. Ask me about medications. I know that stuff. Ask me about the medications I use for my ADHD. I can tell you all about that. Tread. Okay, so it's sterile arthritis, urethritis, conjunctivitis. Yeah, I'm right. Look, I don't know this stuff. I know this stuff what I'm looking at. Transmission method for typhoid fever. Person to person. Oh, okay. I figured it was that, but I didn't. Huh? Nah, it's human to human or contaminated food. Typhoid fever. Fucking hell. I'm just reading it. Left colon. It's culture. Yes, this is all GI. This is all GI bullshit. This is the stream today. The stream today is all GI bullshit. Honestly, I would have preferred just flashcards. But that's fine. But okay, fuck it. I'm gonna just talk. What? No, well, Kimmy, you already have GI issues. They're just gonna make it worse. No. Why would you want to do that to yourself? Stop. My god. I still have to go through all the liver diseases too. Well, okay, you know what? Fair enough. Fair enough. I mean, I guess they do. Kimmy, that's not good for you, please. That's not good for you. I mean, same. I also am lactose intolerant. I just tank it. Because of ice cream. I take it all because of ice cream. Ice cream is worth it. Exactly. Ice cream is amazing. Literally, I was like trying to like find, speaking of ice cream and like dairy things, I was trying to find like mascarpone cream or mascarpone cheese like earlier today. I couldn't find any because I was trying to like get mascarpone cheese to like make tiramisu. Because I have been craving tiramisu and I will always be craving it until like forever, until I make it. I just haven't found any, which is annoying. You should eat ice cream. You should eat ice cream. You should eat ice cream, is what I'm hearing. Okay, we're gonna go with... You know what? Screw it. I can't concentrate on this anymore. We're playing games. We're playing games after the ad. It's a category? How do I change the category? We're playing Code of the Lamb. Because I really want to play some Code of the Lamb right now. I have been thinking about it today. I really want to play some. So we're playing it today. Give me a hot second. Wait, there we are. And I'm also going to mute this. And the game should be loading. There we go. I'm gonna make myself tiny. Tinier. Put my little cult hat. Yeah. Yes. The game where we join a cult and eat poop. But honestly, I haven't been making you guys eat poop because I am a kind and just God. And you should be happy about that. I did. I did. Wait, did I not? I did. The gaming is now Cult of the Lamb. Why is it so quiet? I thought I was like losing my hearing. And then I remembered, oh no, it really is just quiet. Putting at 65. How does it sound? What do you mean the cult has no followers? I know I have followers. What? This is... I literally have followers. There's Blue in here. There's Zanza. But... Wait. Wait. What the fuck? Wait. Wait. I'm gonna close the game. This is not supposed to happen. Where's the extension? It should be on. Ah, wait. Oh, is it because I updated? Is it because I fucking updated the game? I'm gonna cry. Damn it. I was like wondering because like I have cult members in my cult. I have cult members in my cult. Oh god, good luck. Have a good night. I am going to do settings. Via is Twitch. How do I, wait. Give me help. Where is Twitch? Oh, I see. Okay, that makes more sense. Okay, there we are. Okay, I'm gonna connect with Twitch again. Connect my game. Authorize. Is it back? There we are. There we are. Amazing. We're back. Look at us. Look at us with our cult. It's working. Thank you, Kimmy. Thank you, Kimmy. You're so kind. Oh my lord. Okay. Now I can do what I wanted to do. Cult follower raffle. Cult member time. You would like to join? This is your time to join. I'll wait. Give me a second. I'm gonna put some water in my little cup thingy. 2 seconds. I'll let this continue. Okay, I'm winning the raffle. Oh my god, it's Kimmy! Yay! Oh my god, I can pet the Kimmy. I'm so excited.
Oh.
And then we can have another follower. I'm so excited. I mean, I can bring you back in a minute. I don't have the ritual yet. But we have another follower raffle. That way, if anybody who hasn't joined wants to join the cult. Join the cult. Customize your follower and then join the cult. It's okay. I'll bring you back. I promise. Yay! Amazing. You're a germaphobe, but you have strong constitution. How does that work? Oh god, you are... Oh no. Where forgot that would happen. I am going to re-educate you. I am so sorry. I will take a photo of the cult. Go! Leave! I will take a picture of the cult and photo. T. You need to be re-educated and given eye drops. You have pink eye. You have pink eye. I will happily give you eye drops once you're okay. But you need to be isolated. Consider it quarantine. Consider it quarantine. Where is body? You will have eye drops tomorrow. receive your eye drops. No worries. Okay, yes, you need eye drops. That's true. But I think you need to be isolated for a little bit. Consider it quarantine. It's fine. Wholesome. I promise you. You just need a day. All you need is a day. You'll be fine. Yeah, see why I think you need to be quarantined for at least a little bit. I just need to see. It's a trial period. Consider it a trial period. Consider it a trial period. You'll be fine. Thank you so much for contributing to the totem. Amazing. And I am drinking water because I got more water. Don't you worry. I had to refill my thingy of water with water. Okay, it looks like everybody's a little bit hungry though, so I'm gonna make some food. Oh shit. Did not mean for that to happen. I was a little too I was overly confident. I thought I could make it, but I could not because yeah. Oh, okay, it hit me. Don't worry, it hit me this time, I think. I heard it. I heard it this time. Yes, yes. It hit me! It hit me! Well, except for that one. I'm sorry for laughing. It's just what? Okay. I deserve that. I deserve that. I deserve that. Yeah. There are enough beds for the flock. What do you mean? You're lying. Okay, finally, it hit me. It hit me. It hit me. Oh. Amazing, see? You're normal now. I fixed your eye issues. I fixed your eye issues. You just need to do it for You'll be fine. Look, sometimes you just aim too fast, or I don't know. Sometimes you just miss. It's normal. Human error. Eye issues. Oh, basically, one of my followers had red eyes. So I had to put him in the little, I had to put them in the container. That way they could be quarantined, so I could fix their eyes. I totally didn't take their eyes for myself. I totally did not take their eyes for myself. I need to figure out how to add that, actually. How do you add the little voice thingies? I forgot to do it. I'll do it before the next one, I promise. I'll do it before Saturday. What? What was my fate? What did you guys decide on? What happened? I guess. Oh well. Because I don't think I noticed anything happen, like faith-wise. You wanted no more beds? You're so rude. I like making you guys have beds. Don't give her food. I keep you guys fed. I give you shelter. I'm fixing your beds. Like, come on, you should love me at this point. Well, you guys. Well, should I fulfill this desire, you guys? Should I do it? Should I give this follower what they want? Yeah, fair enough. Might as well. Might as well. At least it ain't Vanny this time, right? Oh, what? Ooh. Oh my god. Who the hell just... Thank you. Who is Sipso? Thank you so much. Hi, welcome. Well, firstly, thank you for your first time chat and follow, and thank you for subscribing. I am glad that you like the vibe enough to like stick around. That has like, oh my god, thank you. I'm still shook, but thank you so much. I still get surprised every time this happens. But like deadass. Thank you. What? Oh yeah, I do. I do have founder badges. Yes, because I am new. This is very new to me. Yes. Also, hi, Mom. How are you doing? How are you? How have you been? It literally has only been like a few hours since I last streamed today. I'm still surprised every single fucking time though. Like, what? The fuck? Huh? It's still spooky to me. Like, crazy. I gave him shit though. He ate shit. Literally. And again, well, you gotta... Wait. I actually have no clue, like, how to... I don't know anything about this. I don't know anything about these badges. I don't understand. Legitimately, I got onto Twitch because it seemed fun, and it's somehow surprisingly working. I'm still very much surprised. Deadass. What? Oh no, he's dying. Oh no, he died. Rip. Mocha, why are you scared of death? You're literally a doctor. But I'm glad you're doing well. Oh yeah, Princeps did give you a sub. Well, Well, that was... I didn't realize that. Firstly, I didn't even realize that was gonna happen. Wait, so like, who... How... So, if... So, give... Huh? But I appreciate it. Deadass, like, legitimately. Look, I know nothing. Like, I don't know what the fuck... I mean, I know what a gifted is, but, like, what's the difference in a... So, if you subscribe, that's a founder. But if you gift subs, is that a founder? Oh... Founder is first 10. I see. Now it makes sense. Crazy. Well, thank you, and welcome to Spectral Anomaly. Oh, honestly, I didn't even know that was a thing. Look, I don't even know how to set up a Discord. I had help for that. Oh, I mean, I appreciate it. I genuinely appreciate it. Thank you. Look, hey. I will take all of the help that I can get. Though I do get a lot of help from Mr. and Mr. Managers. I mean, yes. That was because of help. It was because of help. I would not have done that on my own. My Discord on my own was 3 channels, and that's it. My Discord on my own was 3 channels. I had help to make it look better. Exactly, see? Seek helped a lot. Seek helped me set this up, because I don't understand what I'm doing. I can do statistics, and I can do sutures, and I can fix human. I can fix human problems. Except for the human problems where people want to, like, eat tapeworms for some fucking reason. I can't fix that. That is one problem I cannot fix. Like, I got a lot of help from Seek. Seek is Mr. Manager. Well, I mean, I can't fix you, Palm, because I don't know you well enough, and I am not your doctor. And I am still a student. And yes, blind leading and it's low-key giving blind leading the blind, but you know what? It works. It works. I'm struggling. Like, give me the fucking thing. Damn. Oh, I can make a big house. Cool. I will make that one a big house. Yes. Welcome. Join us. I will find another cult member so that you can become a cult member. You can always... Oh my god. Another one broke apart. I'm gonna crash out. Before I go out to fix the outside, I am going to... Okay, Twitch is deciding my fate. I am going to fix house. It is house. There we go. I am gonna do this thingy right quick. I would like all of your devotion. One of my tenets is do not eat tapeworms. You're in this cult forever. And you will stay alive as long as you follow my rules. And one of my rules is not eating tapeworms. Thank you. And thank you for joining my TED Talk. That is my TED Talk. Oh, wow. Crazy. Oh! New tenant. New thingy. I can declare new doctrine. Let us do work and worship. This, whatever the hell this is. Glory through toil, holy day. I'm gonna give you guys a vacation. Because I am a kind God. I am a kind God. So I don't know what fate you're going to be determining for me today. I hope it is kind. Or I am kind to you in turn. Something, I don't fucking know. Weird occultist language bullshit, as above, so below. I don't know. Saying random occulty obscure words. Random occulty obscure words inserted here, I guess. I don't know. I am making a thingy. Doing this. 2, 3, and 4. There we go. Am I free to go do the thing that I was gonna do, which is go find more cult members? Oh, wait, I should. What am I wearing? Actually, tab player. Damage increases after each kill, but resets when hit. Okay, got it. Takes double damage, which means I should never get hit ever again. That is what I am learning today. I will never get hit ever again. Oh, also, is it okay if I extend my stream for like an hour because I got into this game? Is that okay? Because like I'm still awake. I want to finish one run in like this dungeon, and then I'll end. If things okay. Oh god. Please. Oh, Lordy. Oh god. No, please. What? Oh yay, thank you. Look, I'm just asking. I don't know who's next on the schedule because I always forget. I forget who was next because I remember there is schedule and I do check the schedule, but what the fuck? Oh, it's Spider Guy. 1 second, I'm gonna read this. Have you thought of what awaits you once your task is completed? What is to become of you? The lamb is, after all, the sacrificial beast, bred to slaughter. If I cannot stop you, then I can at least prepare you for the suffering to come. He was the fifth bishop of the old faith. Our brother, the one who waits. Back then, he was known by the name Narindo. Oh god. I'm gonna have to kill them. Rip. Oh, nice! I see. Mondays are the slow days. Got it. Wait, what day is it today? Is it Monday? Wait, is it Monday for EST right now? I thought it was Tuesday or Wednesday. Is it Tuesday now? Or EST or Wednesday? I always forget what day it is, deadass. I should actually check, honestly, nowadays. Oh god. Oh lordy. Oh, Tuesday. Okay, it is in fact Tuesday, my dude. I see. Perfect. Thank you. Because, like, that's what I get confused by sometimes. Because, like... Oh, Jesus Christ. Not again. Amazing. Thank you. Yeah, because technically it is now Wednesday, my dudes. My time, at least. Oh, lordy. God. please. Oh my god, finally. What? Yeah. For me right now, it is 2/11/2026. Because my time basically goes from Tuesday into Wednesday. So I start my stream Tuesday, and then it ends Wednesday. Yeah. Yeah. It's a very confusing schedule for me. Which is why I just operate in EST time. Because I don't know anything else otherwise. Yeah, I'm like 13 hours ahead of you guys. That's the interesting part. Kemak can make relic from anything. And nails. Lamb tails. Weird bullshit that you give me. Dead body parts. Castins. Tapeworms. All of that. Oh god. Oh lord. Thank the fucking god. Oh, nice. Got you. The days I picked are slow. Perfect. Because, like, basically, like, my days that I can stream are basically, like, the weird days. So, like, my Sunday, which is your Saturday. My Monday, which is your Sunday. My Tuesday to Wednesday, which is your Monday to Tuesday. My Tuesday to Wednesday, which is your Monday, I guess. Yeah. Because I don't know how to play the lottery. I don't know how to play the lottery, that's why. I would be the worst person to ask for lottery numbers. That's why. I would be the worst person to ask, because even if I knew what they were, I'm gonna forget them. I can't, like, check that shit. Oh my god, I survived. I'm so happy. Oh, amazing. Amazing. Ooh, what are you? Honestly, if I go... Let me think here. If I go here, then I can go there. Yeah, I want to go here. I want to see what the hell is up here. Oh, wine stuff. Ooh. I can have a whole Martha's Vineyard up in here. I see. I'm learning. Awesome. I have grape and grape seeds. Amazing. I mean, yeah, I'll happily do that. Absolutely. Jesus Christ. What? Huh? Huh? I think I am going to sacrifice. I'm gonna sacrifice Veffer. Veffer kind of looks weird. Sorry, Veffer. Well, like, if I knew the answer to that, I would tell you. But granted, I feel like it's gonna happen at the same time. As this is not how time works. But then again, because like, I don't really know if I'm like actually in the future or not. But then again, I don't know, magic and shit. No, I am sorry. Whoa, a relic. Can Max sustains herself still? Match were we in the bosom of the last of the first gods? And will them not ourselves? Oh no, I will do this one. I think that's gonna help me. Yeah, no, I am sorry. Like, I can promise you that much. If I actually had the ability to predict the future, oh, I definitely would. So honestly, I feel like the best power related to time would be the power in Katana Zero. Because that would be like infinitely far more useful than whatever the fuck future sight I could have. That would just be 12 hours in the future. But like, the Katana Zero power is like infinite trying and failing. Like infinite trial and error. That's cool. And super helpful, I feel. Oh, I mean, at least I didn't I didn't sacrifice like one of you guys. I didn't sacrifice one of you guys. I am kind. I mean, the one who waits did say I should treat my followers as assets. However, yeah, I gave you guys food. Healthy food. Food that's good for you. Oh god, please. Please, oh lord. Oh, these fucking weirdos. Stop it. Stop it. Get away. But yes, I am kind, I believe. I believe I am a kind and benevolent god. Though, I might not be that apologetic for most things. Because I mean, how can I question my own self when I did nothing wrong? You know? It's not my fault. Not my fault. Like, it ain't my fault. It's fine. It's fine. It's fine. And mock again? Interesting. I'll take that. Absolutely. I will happily stop time for a few seconds. Twink, well, I am... What? What do you mean pull a lighter and do a ghastly check? Wait, I actually don't know what that is. Like, wouldn't that cause an explosion? Or maybe I just don't know anything. I think I just don't know jack shit. Where is game? There's game. But I mean, like, if you like feel sleepy like that, maybe like check out, like maybe go outside and get some fresh air. Well, I feel like the goal is to not blow up, but find out if there is a gas leak. And I feel like there's other ways than to accidentally blow up. I feel, I believe, based on vibes and vibes alone. I feel like the goal is to find out without explosions. Though I don't know how that would work. Like, don't ask me, because I don't know. Ooh, wait. No, I think the ice is going to be helpful, so I don't die to random bullshit. See, like that. I didn't die to random bullshit. Amazing. Honestly, I'll take that because I need something faster. Necromantic acts less important. I need something that will save me. Keep me alive. Jesus Christ. What hit me? Oh Lord. Nice, I got a heart. Amazing. I mean, you may want to affect the trout population, though I feel like there are better uses of your time than doing that. Jesus fucking Christ almighty. Oh my god. Wait. How did this happen? Why do I have Alan on my head? Is it Shift A? Is it middle button A? Tab A? How did this happen? Why do I have this on my face? How do I fix this? How do I fix this? How do I turn this off? Wait, how do I turn this off? Wait. Oh, it's middle mouse button A. I mean, I'll be Alan. Fuck it. I guess I'm just Alan now. I guess this is just me. This is my life, as some may say. Though I don't even, though in all honesty, I don't know why I even have this toggle. Wait. Me was born this way. Okay, though, in all honesty, I'm a little bit confused. Oh, this motherfucker. I'm going to kill him. I'm going to feed him the most terrible food on the planet. If it means me don't have to worry about him and his antics. Kai Spy, I'm going to kill you. Wait. Okay, though. Wait a second. Random question. Isn't Ellen's voice basically just a Valley girl, but Kim Kardashian? Because that's what it sounds like to me. That's literally what it sounds like to me. Would I be wrong? Would I be wrong in saying that? Because I feel like I would be correct in saying that. Wait. John from account. John from account. I don't think I know this reference. Yeah, I don't think I know this reference. Or at least it does not sound familiar to me. What is John from accounting? Legitimately, what is John from accounting? I'm going to be kind to my followers today. Thank you so much for contributing to the cult totem. But yeah, so like, oh my god, no, I remember why I made that toggle. Because the toggle was supposed to be for the voice, the Valley Girl, because like I thought they were the same. I thought they were the same. But obviously, if they are not the same, then I was mistaken. And so, I don't know. Legitimately, I don't fucking know. And now they all love me. Or at least they better. Or else. No. This is what happens when you drink raw milk. People die. Yes. This is what happens. People die. This is your fault. This is your fault. This was your fault. It literally was. It was hilarious. My god. I don't even know how he died, actually. It was probably old age, to be quite honest with you. You're welcome. This is what happens when you drink raw milk. You suffer and die from the consequences of your actions. And also, you might get a tapeworm from it. So you know what? If you really want to, go ahead. Oh. That was disgusting. It was giving C. diff. Wait, I need to talk to them. Inspire everybody. You're not allowed to have raw milk. I'm not allowing it. But you know what? You guys can do whatever you want when I am away on the cult continuum. Like when I'm like out on a cult mission. And also, please don't. I know you're joking, but like, please. Like the jokes are fine. It's more like the I am worried. Yeah, sure, I'll buy a cult member. There we go. Have fun. And that too, like, Twinkie, that's quite worrying. It's a bit worrying. It's a bit worrying, I feel, I believe. You can get violence on your own time. The violence that's happening is only what's on screen. I'm getting a real heart. There we go. I'm a real heart. Getting a real heart. There we go. And also, I don't know what you had for breakfast. Hope it wasn't violent, but it looks like it was. Concerning. Oh, Jesus Christ. Oh God, please. Please, God, no. Oh God, please, no. Okay, amazing. There we go. Wonderful. Another heart. Awesome. Also, to satisfy your satisfy your glut for violence, you could just play Code of the Lamb. Though you are at work, so I understand why you wouldn't be. Oh, Jesus Christ. I'm so bad at video games. There we go. No! No! No, you have no more Diet Coke? I would cry. I would cry. Granted, I haven't had like Dr. Pepper in years. Actually, 2 years. Dead ass 2 years. So you know what? Life is tragedy for all. I have unlocked a new build. I need to get this. I need to get a new follower. Are you kidding me? Oh my lord, wait. I'm making sure I'm gonna survive. Wait. Oh my god. Please. Please? Please, please, please. Help me live. Hey god. I'm like, I'm a heart. Okay, one heart. Okay, 1.5 hearts. Oh god. Finally. Ah. Oh my god, I'm surviving. I live. I live. I'm so happy. Ah. Amazing. I need hearts. I only have... What? Oh, I might die here. Oh. Amazing. I'm alive. What the fuck was that? That was insane. Spooky. Spooky. That was crazy. Ah! My god. At least I don't need any more hearts now, right? I mean, I want the blue hearts, actually. Deadass. I would like blue hearts. Thank you. I can't use these other hearts, but I can definitely use the blue ones. Damn, I wish I could have gotten there. But I can't. Ah. Oh my god, I might actually survive this. I hope you all are going to be kind to me. I hope. Please. Ah! How dare. I will cry. Oh, I mean, I only have one active curse card. I only have one active tarot card. I only have the one. I need that. I can't use this one. Oh my god. Ah. I'm alive. Holy shit. I'm surviving though, somehow. That's nice. Oh, wait. Necromantic hammer, you know... Sword. I am hoping I live to see the day. Oh god. Oh god. Oh no. Please let me live. Ah! Oh my god. Terrifying. I survived. Amazing. Crazy. God, my fingers, my hands hurting. Wait. Is there anything in this room that I might need? Oh god. I am trying to like lock in, that way I don't die, but I can't really concentrate on chat when that happens. So like give me a hot second. So like that is why I am not speaking as much as I would like to right now. I am suffering. Oh lordy, blue. Blizz. Liz. Oh god. Oh wow, that actually helped me. Amazing. No heart? Seriously? Damn it. Unfortunate. Oh. Unfortunate. One day I will get more than just what I already have. Oh, wait. So I still get the benefits of the card even though the card is no longer active? Okay, that's interesting. I think. Or is that a bug? Oh, I got Divine Intervention. I need the Shield of Faith immediately. Shield of Faith! Save me. Oh! Amazing. Amazing. I have things now. But okay, give me a second. I'm gonna like stretch my hands and drink some water. Because this can hurt your hands. So you stretch them. Give me 2 seconds. I'm just drinking some water. Oh, wait. The razor is going to be helpful. I have her back. Yeah. No, I need this. This is going to be a little easier. Hopefully? Oh, God. Save me. Oh, yeah. Oh, yeah. Damn. Okay. Crazy. Okay. I'm now gonna stretch my hand a little bit more. Awesome. I die? Nope, nope, not jinxing it, not jinxing it. I am not jinxing it. I'm not jinxing jack fucking shit. I'm gonna not say a thing about how I am doing in this game. Because it's like the Q word. You don't say the Q word. Say it's busy enough. See? Oh, cool. I can sacrifice someone. All right. No. Weber? None? No. Not. I'm sacrificing Brian. I think I have enough. I think I can get enough hearts for this one. Save me. Are you? Okay. Damn, I literally almost got it. Oh well, that's okay. That's okay. I survived. For the most part. For the most part. It could have been worse. Literally, I was doing my best. I'm so sad. But yeah, thank you. I am drinking Oiter. And thank you so much for contributing to the totem. Soon and very soon, I will hopefully be able to lock in. Well, there might not be today. You know what? I am gonna get the mission. If I get the missionary and the missionary too, it should be fine. What? Why are you working? You don't need to work, Blue. The fuck? I appreciate it. Oh, the day of rest is done, I see, I think. Interesting. Interesting. Alright. Well, I think this is a good time for me to save. And yeah, good time for me to save and end. Save, go to the main menu. It was really fun. I got some studying done. And I think this is a good time for me to rest my hands. And also like study a little bit more offline. So I'm gonna look for... Ooh, yeah, thank you! I have been trying to like do better on a lot of stuff in general. Like, can you tell? I remembered to do the thingy, the posty thingy, but I kind of forgot like some of it. A lot of it. I forgot like what I was supposed to like post or where. That's okay. Who is online? Whomstative is online. No, for real, like Whomstative. Whomstative is online. Wait. Oh wait, I can just check the calendar. Is anybody online? Like, am I calendaring wrong? Do I not know how to read a calendar? The answer is yes. But like, ooh. Oh wow, yeah, no. There is no one on. Oh wow, that's at like early morning. Okay, well, I'm gonna send people over to Nuki because Nuki's cool. Also another doctor. Wait, where is he? Where is his stream? He's playing League, the one of the worst games ever. But we still like him anyways.